members, staff, and guests to the November 27th, 2023 Haldeman Norfolk Health and Social Services Advisory Meeting. I would like to remind everyone that our meetings are web streamed and televised. With that, I call the November 27th, 2023 Haldeman Norfolk Health and Social Services Advisory Meeting to order. Are there any declarations of pecuniary interests? Seeing none. Are there any additions to the agenda? None. We have two presentations today. The first presentation is from Sharon Moore and Melissa McCallum from the Greater Hamilton Health Network. They are here to provide us with a presentation on building community health together. I welcome you to the podium. You have 10 minutes for your presentation, and I'll let you know when you have 1 minute left. Thank you.
Hi there. Thank you for having us. Good morning. Today, I'm going to give an overview of the Greater Hamilton Health Network, which is one of the province's Ontario health teams. I'll go a little bit into what an Ontario health team is, and then specifically the work of the GHHN. Next slide, please. So what is an Ontario health team? In 2019, Ontario health teams were a new way of organizing and integrating local healthcare. In 2019, we saw the 14 LHINs across the province dissolve, and then the announcement of Ontario health teams as being more of a local organizing body for community care across sectors. And really the mandate was to strengthen care from the patient journey perspective, to allow providers to work together in a more integrated way. I often describe it as, organizations working without boundaries, really looking at how to create an ecosystem for a community. So Ontario health teams were all approved in phases over the years, starting in 2019. Hamilton actually applied to be an Ontario health team on their own in 2019, and we were approved as one of the first 24 teams in November. It was a little bit through the pandemic that the ministry came back and said, you know what, it makes a bit more sense based on how patients are accessing care that you incorporate a portion of Niagara Northwest, which is really the Grimsby, Smithville, Lincoln area, and Haldimand County into the GHHN. So we actually rebranded from the Hamilton Health Team to the Greater Hamilton Health Network to reflect that full attributed geography. Next slide. So, at the heart of it, Ontario health teams are really to help connect care. On the left-hand side, we see that, providers and patients seek care in a number of buckets in communities. Patients could cross over many boundaries from community care to acute care, back to social care. And really, we want to strengthen that fractured system into a very, integrated circle of care. How are providers going to work together in a bit of a different way? How are you going to share information and really plan for a community, moving away from just planning from organizational lenses into planning for the population health of a whole community? Next slide. So like I said, we were one of the first Ontario health teams to be approved. There are now 57 OHTs in the province, and that is full provincial coverage now. And again, those OHTs were phased. So there's about 5 phases. The first phase started in 2019. The last phase of OHTs were actually just approved earlier this year. The GHHN has an attributed population of about 700,000 residents, and that actually makes us one of the larger teams, not in geography, but in patient population size. Again, we serve those 3 distinct geographical areas. And when we look at our population, and I know I don't need to, remind everyone about the population concerns of this area, but we also have, this mix of rural and urban communities within our OHT. We share a lot of issues amongst those rural and urban areas, such as housing, mental health, addictions, poverty. We also know that both areas have very high areas of material deprivation, which really lend into understanding health from a social determinant lens as well. Next slide, please. So the vision and mission of the GHHN is really to provide a healthier community that provides an equitable and seamless continuum of care. We are going to do that by building community health together. Next slide. So in September of this year, the Ministry in Ontario Health actually made some additional announcements about the Ontario Health Team model. They announced that 12 of the 57 Ontario Health teams would actually progress an advanced working model. So the GIN was actually selected to be one of these 12 teams across the province, and we were selected based on leadership, governance, and some of the work to date. And what that means is that we were given a different work package of items to work on for the next 2 years. And it also means that we're going to be able to apply for designation as early as December of 2024. Now, designation was actually first announced in the Connecting Care Act in 2019. And it sees that Ontario Health teams would receive the integrated funding envelope for their community. So they would be able to enter into an accountability agreement with the ministry to deliver services for their population. So that's a new way of seeing the OHT model evolve. To date, we've really been working under collective action, coming together as a coalition of the willing. But we see the ministry signaling that OHTs are really going to be a model to last, that they're looking at, giving increased funding, especially for services to be delivered for a community. Next slide, please. So in terms of, what are the strategic priorities of the GIN? There are many, but they're broken down into these main buckets here in this diagram. The first is integrated population health. We do a number of activities and projects related to local health concerns. We see a number of work areas in digital and navigation. How are we going to connect people to services in a more robust and coordinated way? We know that system, is not well set up right now. And how does our local services connect in with models like Health 811, which is the provincial, navigation services that replaced telehealth? We do a number of items under governance. The GHHN was actually the first Ontario Health team to incorporate in the province into a not-for-profit. That model's actually been chosen as the model for all OHTs to move forward. We are starting work as part of this advanced OHT work under integrated health pathways, and we're going to be focusing on 3 main disease processes. How do we connect care for those living with CHF, COPD, and those with diabetes with a risk of lower limb amputation? There is a huge work bucket under primary care. We know that both areas and across the province, we have a shortage of primary care and inequitable access to team-based primary care. So how do we connect primary care to really have a strategic voice into local healthcare planning? And the last one is home care. Not in the slightest, as well as the September announcement as part of this 12 advanced OHTs, it was also announced that over time, the home and community care services that are currently being delivered will shift into the OHT model moving forward. Overarching, main priorities that we see as part of our local work that's really important is taking a patient and community lens. We want to engage patients and communities into the design of our work. We want to make sure that what we're doing is equitable. We know that people in our system suffer more than others based on how the health system was designed. And while we do this, how can we actually protect the environment and be sustainable while we build up new initiatives? Next slide, please. This is just a snippet of our current structure right now, and it is evolving. As I said, we are an incorporated not-for-profit. We have a formal board and project management office, which I oversee. Underneath that are key strategic stakeholder councils, which have direct reporting relationships to our board. You'll see that Haldimand is one of those key stakeholder councils because when we did the integration, we wanted to ensure that Haldimand had a lens on what was most important to them and to directly feed that right into our board. And underneath that, we have several working groups. They're not all on the screen, but we have right now over 71 providers that work on our GHHN activities on a day-to-day basis. Next slide. These are just a couple of highlights. Again, we've really paved the way for governance in the province by incorporating and really developing a very robust governance structure from the very beginning. The GIN actually won the top Integrated Care Award at the Integrated Care Conference in Denmark in 2022 on our work with women's homelessness in Hamilton. We've prioritized health equity from the very beginning. We actually started our work in 2020 with a health equity review. We've actually created the first online centralized booking hub of any OHTs where you can log on and book an online, I'm going to move on fast. I'm going to just leave that screen up there and I'm going to move over to Sharon so that we can finish up. Next slide, please. Okay.
Melissa. Thanks everyone for having us. So I'm Sharon Moore. I'm the president and CEO for Haldeman War Memorial Hospital and Edgewater Gardens, but I also am the co-chair for the Haldeman Stakeholder Council. So as Melissa just described, reporting through to the board, we have our own stakeholder council in Haldeman. And when the province came to us and asked us to join Hamilton, we saw it as an amazing opportunity, which I think you will see that we are definitely experiencing the benefits of working together and serving the populations as one. So some of the highlights, we have the Lego Hope program, which is the Let's Go Home program. That's where we get a connector into our emergency department, and they are working to avoid emergency patients becoming inpatient admissions. So they're linking patients to services in the community. We also have other highlights, but I want to get to the next slide since we're running out of time. You can read the other highlights. A couple of weeks ago, we were at the Caledonia Lions Center or Lions Club for our first Haldeman Older Adult and Caregiver Health Drop-In Day, and we served 79 participants came. We had food hampers. We were able to maximize use of a donation of funds from McMaster. So this really helps get our services out there, connects people where they are comfortable coming in as a community, and we are going to be repeating these days. So we started in Caledonia. The plan is to go to different community areas such as Dunnville, Cayuga, others in Haldeman, and serve the population further. So you'll see a list of the participants that were there that day. We had what we think a very successful day. I think the next slide has some pictures of that day. You can go to that one. So there was available food at the event because of our sponsorship of the $10,000 donation, but also because we also had food hampers for people to take away. So that was a nice little enticement to get them there. So in terms of the Haldeman Stakeholder Council, we continue to work with the board. We also have one of our members on the Haldeman Stakeholder Council sits at the GIN level board. I sit as a governance committee member at the GIN board. So this is where our advantages come because we are really learning from each other, working together, and trying to make the best for the communities that we serve, as diverse as they are. So I think we're probably out of time, and we went through the last bit very quickly, but thanks for having us. It's great to come and showcase some of the work.
Thank you. Thank you both for coming today. And your work is very important to our communities. So any questions from the committee? Go ahead, Councillor Van Riesche.
Button again. Thank you. I'm not medical by any way, means, or other. I'm even hard pressed to get a Band-Aid out. But the Greater Hamilton Health Network, and when we're looking at that, why you brought this presentation here is because we're looking at this newer models that are coming out. Is this, just give me the reasoning why you're here. I have to go right down to basics to start over because we operate our system through Haldeman Norfolk. So I'm just wondering, you're describing a lot of the activities that occur from Hamilton into Haldeman, which is great. And how does that relate to what's coming up?
Mm-hmm. Yeah, I think the main purpose is number one, to make sure that, we're disseminating information about the infrastructure changes across the province, because a lot is actually changing at once. We're seeing, local healthcare bodies change into these Ontario health teams over the last few years. And then we see big announcements like things like home care are probably going to change locally as well. And the Ontario Health Team model is really going to be responsible for managing and planning a lot of that change. So I think that's number one. And number two, I think it's helpful for just the structure of the way Haldeman Norfolk is to understand that, our team is the way that they've organized Ontario Health Teams. Our team is looking after Haldeman County and working with them. We're integrated with Haldeman. Norfolk is part of a different Ontario Health Team, which I think is presenting right after. So I think that there's some local nuances that we wanted to ensure the council knew about.
Yeah, I knew that the province is looking at this. You're telling me you're already working with Haldeman. So
Yeah.
I didn't know that.
Okay.
That's good. I didn't
Yeah.
know a decision was made with Haldeman Norfolk that I knew there was a great idea of going towards the Hamilton end and that we were looking at options going at the other direction. So I didn't know that was implemented or things were acting. If we could get some information on that.
So, Sarah, you could probably explain best. Thank you.
Through the chair to committee, I just want to be very clear. The Ontario Health Team is completely separate from any talks about voluntary mergers. The Ontario Health Teams have been in action for about 3 to 4 years now. And we wanted to have them both here because we do cross both counties. And so we wanted an update as to how both OHTs are doing and provide us some more information. Neither Haldeman or Norfolk are signatories on our OHT at this point, is my understanding, on either side. So this is a good start for us to talk about governance and talk about how the municipality wants to be involved moving forward with the health system transformation.
Well, that's excellent. I needed that explanation because obviously I didn't realize that, but I didn't realize that we're already functioning in Haldeman. Good.
Any further questions? Councillor Duthie?
Thank you, Madam Chair. And through you, I think this, my apologies, I didn't catch your name from.
I'm Sharon Moore.
Sharon. Okay, thank you, Sharon. Thank you both for being here and thank you for your presentation, Sharon. If I could just ask you, as based on the relationship that you have representing the work that you do in Haldeman, I guess my curiosity is if you feel that your needs are being met as being part of this group, or areas that could be improved upon as you move forward in terms of representation for Haldeman in this, greater Hamilton network.
Yeah, thank you for that question. I think that's an excellent question. And when Haldeman first set out on the OHT, we sent in an application to be our own standalone OHT. The province did mandate us to work with Hamilton, and we saw it as an opportunity. But of course, we were a little bit disappointed. We wanted to work on our own OHT at the beginning. But now that we are so far down the road, we see it as an advantage because we learn from each other. We get the expertise of not only Melissa, but the rest of the team. And now, as being one of the first OHTs to be incorporated, we are being looked at as a model for other OHTs. We are, I think just that's older caregiver day that I just talked about. We were granted some money. It was a lot of the GIN staff that helped us fill out the application, get that going. So when we were working on our own as Haldeman alone, everybody had other jobs and was working off the side of their desk, so to speak, to do these types of activities. Whereas now we have some dedicated resources working through the GIN model. So it is an advantage in terms of, I think it's always better to work together, to partner with others. You learn, you grow. Definitely have a little bit more access to resources from my viewpoint. And I have been the co-chair for over 3 years now. So I have been through the sort of transition period. And I only see it as a benefit to be one of the first OHTs to get advancement, which means we get more attention, we get more funds, we get more opportunities.
Thank you, and I appreciate that response. It's actually very helpful information. I think in your presentation, you talked about the population served to be about 700,000 people. Is that correct? That seems like a lot. So I guess I'm just curious in terms of operating within that model, covering that size of a population. How does that really work? And is it too many? Is it not enough? What's the capacity? I'm just curious.
Mm-hmm. Yeah, it is a very large population. And I will note that Ontario Health Teams are all funded the same, regardless of their population right now. We're seeing some additional funding come in for the 12 advanced teams, so we're one of that. So we really welcome that. But I will say there's lots of advocacy about, even when you look at the population of an Ontario Health Team, they're all not the same, taking into account things like the marginalization index, poverty, housing, mental health and addictions. Those are all things that are very real, huge crises in both of our areas that require more deep and detailed attention. So I'll say that, at a scale, we need to grow the team. We need to grow the providers and the shared leadership model to fully take care of our full attributed population. We've been building up to that. We're not there yet. And we need to see that investment and that the advancement of the teams moving forward, I think, is being signaled as a priority for the government, and I hope that continues. But I'll say that we bang the drums a lot about the fact that our population is large and we serve a very large area as well. So we're working on it, but it takes a lot of the providers to be part of this work as well, right? There's a lot of good work that can be done within the current system if we work together, versus also a set of advocacy for more funding, more attention to a very large populated OHT.
Thank you for that. You said something there that struck me that I'm struggling to get my head wrapped around, if I'm honest, that your funding model is the same regardless of population size.
Right now.
That was always the way from the beginning?
From the very beginning. And we see a change in that in September when we were advanced, like these 12 teams will be getting additional funding.
Sure.
So we're hoping that, and this is something Sharon and I were just talking about, we're hoping that starts to continue year after year. Because as you see on those slides, the responsibilities are increasing. Taking on things like home care, that is a massive transformation. So we're going to need to have the infrastructure to be able to deliver on things like that. So I'm hoping that as they see these 12 teams advance, we will be given more funding to expand the work.
Thanks, and that makes sense. I mean, I struggle to understand in that, the needs of the population in, Hamilton, Halton, or Haldimand would be very different than that in the north. And then the funding resources that are required and the services that are available would be very different. So following the same funding structure just seems odd to me. So thank you for your comments on that.
Thank you very much. Those are great questions. Councillor Metcalf?
Great. Thank you. Through the chair. Just to elaborate on Member Duthie's comments, you would think that it would be based on a per capita model, like thresholds of 10 or 15 or 20,000 people at a time to make it fair and equitable across the province. Like if we're one of the largest at 700,000 and we're being funded at the same as somebody that has, or some team that has 300 or 400,000, that's twice as much with the same funding. So it doesn't really make a lot of sense that way, the model.
I totally agree with you. And thank you for raising that. Sometimes I actually don't know if people truly recognize that at all times. I would say that, there are population characteristics that are really unique. The North is unique in its rurality, in its connection points. And I would argue that they require different funding too. Yes, they're expansive. They cover a huge and massive geography, and we have the luxury of having quite a large set of partners. Like already 71 people I've counted are working on OHT activities. So we're resource rich, but with that comes complexity of who is the population you're serving. That looks very different, within the province. So I would argue that we do need a model that's based on not only just the population, but the actual characteristics of the population that we're serving.
Thank you very much. Councillor Van Passen?
Yes, thank you, Madam Chair. Try to tap dance around this a little bit, but there's always a fear in sort of the Haldimand and Norfolk type of municipalities that when we get amalgamated with the big urban center, that a disproportionate amount of the resources are shifted to where it's more focused in, like downtown Hamilton has some major issues. And, the fear is always that us folks in the rustic countryside get forgotten. Now, do you have any comments on how to resolve that? Because a lot of times that fear we have does become reality.
That's a great question. So when we started having our discussions with Hamilton through the direction of the ministry that we should work together to become one OHT, Haldimand maintained a very strong voice and said, we are a little bit unique because of these factors. And I'm sure you can all understand what those factors are. These were the things we were working on our own OHT. We feel these are important to continue focusing on. So that's how the Haldimand Stakeholder Council kind of evolved through those discussions. So we are one of four. I think we're still one of four councils that report into the GIN board. So we have a voice through Haldimand Stakeholder Council. We have a member on the GIN board, and we also have one of the patient advisors lives in Haldeman County as well. So she's also on the GIN board. And then I represent at the governance committee. So we maintain that voice for the Haldeman side of the work that we're looking to do together. But also too, we try to pocket out so we can look at the specific unique needs and say this is the area. We know Haldeman, we have a lot of providers in our Haldeman stakeholder. We know Haldeman and we know the residents and we understand some of the priorities, but always have room to grow so we can use those resources that we're getting through the province to help understand it even better, which will, I think, make it better in the long run. But we have to maintain that voice and having that governance structure, and then having we have a very active Haldeman Stakeholder Council. We have a really great group of individuals from different agencies, large and small. Both hospitals in Haldeman are represented, but then we also have some small agencies that only have a handful of people. For example, True Experience, we have the Midwives of East Erie. So, we have some smaller groups as well to try and represent Haldeman the best we can.
I just wanted to add that that relationship needs to be constantly nurtured. Like that is something that I would say that from the very beginning to now, we've seen a great shift in even the Hamilton providers saying, oh, Haldeman's not here, or we have to think about Haldeman. I think that that's really been built up and changing since we first amalgamated as one team. But like Sharon said, we've embedded Haldeman representation into all of the working groups, unless it's, a specific Haldeman working group where we see just the providers. But even then, I would say that we're learning and growing at how to work together. But there is there's a very strong voice for Haldeman at all our working groups. But we continue to make sure that we have that connection.
Thank you for that. Is there any further questions? Yeah, that was a great presentation, and I'm glad to hear that Haldeman has a strong voice. I knew they would with Sharon at the helm, so thank you very much for that. May I have a motion to receive this presentation as information, please? Thank you, Councillor Duthie, seconded by Councillor Metcalf. All in favor? Motion is carried. Thank you. Thank you very much. Second presentation is from Peter Zoda from Brantford and Norfolk Health Team. I welcome you to the podium, and you have 10 minutes for your presentation, and I'll let you know when there's a minute up. Thank you very much.
And this will go on. It is on. Red means hot. Well, good morning, everyone. Peter Zoda. I'm Executive Director of the Grand River Community Health Center. Has some services down in Norfolk County, especially with migrant farm workers. I also worked at Norfolk General and at your community mental health agency in town, so familiar with some of the issues in Norfolk County. I looked at Hamilton's slide deck, so I'm going to skip over some of my slides just to avoid redundancy. But if I could have the next one, please. You know what, this is your definition of an Ontario Health Team. It's the lofty language that the ministry uses. There is a powerful statement, and Melissa might have touched on this, that we become fiscally and clinically accountable for a set population's health status. And that is a powerful statement, fiscally and clinically accountable. And that's what the vision was 3 or 4 years ago, and that's why we all joined on this. We want to have a voice to influence that mandate. Next one, please. I'm sure Hamilton used the same slide, and I'm sure they used the language. Previously, we were so siloed. Each of those sectors dealt with the client individually and not with little collaboration. And now we're moving towards, next one, please. Client at the center, trying to work together and bridge those bridges between the sectors. Next one, please. This is the list of agencies that participate in our Brantford, Norfolk, Ontario Health Team. And it is every agency that primarily has health services funding. And you might be interested in the ones that have municipal connections. For example, third one down, the paramedic service. is a signatory, Health Unit is a signatory, and John Noble Home is a signatory. And this, the Brant Health Team has a little bit longer history because Norfolk joined later on as prompted by the Ontario Health and the Ministry. And we have now fully embraced Norfolk, although you might be wrestling with whether to be signatory or not. The stats on the right-hand side, we have a population of 193,000, and you see the age and indigenous populations cited there. Next one, please. We have a model of collaborative governance. We do have a governing body. It's still struggling with what exactly it's governing because we don't, you know, I started with that vision statement, clinically and fiscally accountable. We're not near, not even close to having that responsibility yet. We have, and you guys you're going down the path of what budget you have. Like the budgets of the various agencies are not under the mandate of the OHT yet. When the conversation was that the OHT's budgets are the same, there's a secretariat of planning staff. Those budgets are the same. Nothing is changing with the agency budgets that that our respective agencies have. Next one, please. This slide gives you a quick overview of the various structures we have in our OHT model. We have a very strong primary care council. There is a vision in Ontario Health and the Ministry that primary care ought to be the foundation of a transformed healthcare system. And we have a robust family physician, nurse practitioner, and other agency primary care council. We have a group of patient and family caregivers. There's a movement towards patient and family co-design, engaging them, and how to organize our services. We have strong connections to the Indigenous population. We have that joint board I touched on. We have the executive leadership group, which I co-chair. I'm about to step down from that group because I'm retiring, but that's where a lot of the meat and potatoes issues are occur. And we have a number of working groups. That's basically our organizational structure. Next one, please. Here are some of our accomplishments. I won't go over all of this. You can take a look at it later. There's some cool initiatives in this group. The dementia one, have a dementia dream team in an emergency room to try to prevent unavoidable admissions to hospital. That's a cool project, and that's taken off in Ontario, and it's homegrown in Brantford, Norfolk. Some things where we might have overlapping agendas: homelessness. My agency does a lot of work outreach to shelters, and we can't wrestle with the sheltering aspect of homelessness, but we can provide the primary health care that is so often an issue for homeless clients. I'll leave it at that because I'd love some questions. We have the lofty mission and vision that all such structures should have. Together we deliver and advance integrated, equitable, and person-centered healthcare. Next one, please. We just completed our strategic plan, enablers for that strategic plan. Health Human Resources, a major challenge in Ontario health and North American healthcare system. Digital health, we put a lot of eggs in the basket. We're going to do so much better on digital health. Our strategic directions are listed on the right. I won't cover them. They stand. They're fairly clear, and they're probably not all that different from what you're going to see in OHTs all over Ontario. Next one, please. This one might interest you. We have two membership categories in our structure in Brant, Norfolk. We have anchor members that are signatories to our collaborative decision-making arrangement, and we have affiliate members. And for example, your paramedics are affiliate member here. Norview Lodge is affiliate member. Public Health is an affiliate member. And the only difference so far is that you don't sit at our governing body. Now, that governing body is still struggling to find its role because we have these 12 accelerated OHTs that are a bit of a pilot to try to figure out what the model is and what will Ontario Health prescribe to us for the governance model. Next one, please. My bottom line message is, I think the bottom line, we have a lot in common. Municipal councillors care, I'm sure, about the health of that population. We share that original vision for an Ontario health team. So you might want to have a voice at the table as part of that vision. And we have, diving down one level, we have shared objectives in population health. Increasingly, funders are asking, has the Ontario Health Team endorsed a certain project? And it would be good to have a municipality at the table, and you could perhaps tap into project funding opportunities. And there's some example listed there. And there's all sorts of service level opportunities, be it public health, community paramedicine, the next wave of COVID, God forbid, there's collaboration that we can be undertaking. You might want to be tapping into our primary care council and other things. So there's all sorts of project areas where we think we have agendas in common. I think that might be it. Our contact information, but I welcome it. If there are any questions, I can add to what the Hamilton group was saying.
Thank you very much. Thank you for your presentation this morning. We have a few questions. So Councillor Van Riesche, please.
Thank you, Madam Chair, and through you. Yeah, I have a few questions. In comparison to the Hamilton operation, they've been, it sounds to me that they've been in operation a fair bit of time. How long has the Brantford and Norfolk Health Team been in operation?
About 3 or 4 years. So since the launch of OHTs in Ontario,
Since
we've been there from the beginning, and then Ontario Health prompted us to look, and I think Norfolk wanted to be its own Ontario Health Team. I believe they had criteria for minimum population, and they nudged and cajoled us to put it together.
Okay, and it's the representation or the voice. Do we have in Norfolk a voice on your team? I recognize from Hamilton that they do have voice from the Haldeman end. Do we have that, and why not?
Oh, you do have it. You have representation at the executive leadership group. My co-chair is Todd Stepaniak, the CEO of the Norfolk and West Haldeman hospitals. You have so you have a voice there. You're also on the working groups, and one of our Norfolk stakeholders wrote a report on just how we ought to tweak all the workings of our OHT to better incorporate Norfolk, because Norfolk was prompted by the ministry. There was a report suggesting ways for that representation.
So how long have we in Norfolk been associated with?
I'd say 12, 15 months.
Okay, so pretty early on in the beginning stages, and we don't have a lot of, yeah, okay. And
you haven't missed the bus.
Oh, I'm hoping not. And when I listen to some of the programs that are being offered, I start to think duplication. Is that a worry that I should have? Like when I look at the examples of mental health and addiction, we work hard on that. You have an operation of that, and we're part of the Norfolk end of it. Is there a duplication there?
This question becomes, what is the sweet spot for the population to review? I mean, can a table plan for all of Ontario? Most stakeholders would say no, that some geographic separation and for better or for worse, Ontario Health has determined these Ontario Health Teams are the platforms, the geographic boundaries for this planning. That is not to say we'd never, for example, you have so many agencies, Alzheimer's Society, your Community Mental Health Agency, that straddle both Ontario Health Teams. We would not get in the way of collaboration across those boundaries. There's always got to be a fairly arbitrary geographic area. Like the district health councils did it, local health integration networks do it, and OHTs do it. You have to draw the line somewhere.
And you mentioned signatory, and are we a signatory or are we not? And why wouldn't we be?
Well, through the chair to committee, I apologize. I'll make that a little clearer. We took a report to council at the beginning of 2021 concerning the onset of Norfolk joining the Brantford Norfolk Ontario Health Team. And at that time, the decision was made not to be a signatory, but to sit on the executive leadership group, provide a voice for Norfolk. There will be a report coming in early next year to move forward as a signatory. So this is a great introduction of I wanted everyone to know what is happening and what is going on. It's a really important part of integrating our entire healthcare system, like you said, to actually avoid duplicity, bring our programs together. For example, Brantford is running a great homelessness program. Providing healthcare. We ran the pilot down here with community paramedics. So we worked together to have that vision of a different program running with different stakeholders, but bring it together into one program. So us being a part of the greater picture and having a greater voice at the table would allow us to make those kind of decisions and hop onto these programs that are across the entire OHT.
Thank you. Councillor Duffy?
Thanks, Madam Chair, and through you, I think I might address this one to Ms. Page first, because I'm just curious about what our objective is when we're at that table, I guess, in terms of, okay, we want to have a voice. Is it us sitting there as Alderman Norfolk Health and Social Services, or is it specific members within the agencies that make up the Brant Norfolk Health Team?
Through the chair to committee, that's a great question, actually. And up till this point, it has been the selected agencies. So it was the Chief of Paramedic Services, the Director of Norview Lodge, and the Public Health Director, Syed, all sitting on that, representing their own agency within Haldeman, Norfolk counties. Syed has also been involved on the Haldeman side, sitting on their board, sitting on their Haldeman committee. And I think it's important to have both. It's great to have each agency speak to. So on the paramedic side, just because that's my background, that drew me into dealing with more of the Brant paramedics and their community paramedicine program and how we can align our services across the entire region and where that shared information and shared projects come in. I think at a high level, the reticence for signatory in the past or the reluctance to sign in the past was always the question of funding and how that model will happen in the future. There has been no definitive statement from the ministry stating that any funding from any direct funding to a paramedic service, to long-term care, anything like that will flow through the OHT. However, we do expect at some point that the government will combine all healthcare systems and the financing will flow through one agency. So it's important for us on two folds to have our divisions involved at that level to, make those decisions with like people in the region. But it's also important for us at a higher level to be involved to ensure that the needs of the municipalities are met and that the impacts of any funding changes are not then downloaded onto the municipality.
So that was the minefield that I was really curious about how I was going to jump into, but I appreciate you've taken us there. So I guess maybe to Mr. Soda then, do you foresee that funding, because I can't remember on the slide you showed a host of different member agencies from CMHA to the Norfolk Family Health Team to EMS and all of these different things. So if that funding model were to change and it were to filter through, I'm curious how that would even work. The current funding that you're receiving as the local OHT, that obviously is coming from the province. From which pot? Because eventually it's, the dollars are only are finite, and it has to be redirected in certain ways. So how do you foresee that could work?
This is the question. So I'm glad you went there. So the money that the OHTs get, let's just level set on that point. My agency happens to be the transfer payment agency for the OHT. So the Grand River Community Health Center gets this $750,000 a year for the planning staff or the secretariat staff that they're OHT. That is a fairly immaterial amount of money in the Ontario healthcare system. The question here is more, when I said the front end, the vision is fiscally and clinically accountable for the population's health. When will that occur, and will it occur? I'm not sure anyone in Ontario knows the answer to that. I think it's years away, and I might opine. I'm not sure whether municipal envelopes such as yours will ever flow into that. model. But that's a personal opinion more than it is a reference to any official document on this point. There's so much work to be done to have hospital, community mental health, home care budgets put together. The healthcare sector has to get that vision operationalized before I would imagine it would get into municipal sector.
Can I ask you to give your personal opinion then in relation to your full-time day job then with the Grand River Community Health Center, what your thought would be if your funding model were to change and be directed through OHT?
You are always a little wary about the loss of authority and control. That I understand, but increasingly the integration of funding models has proven to be the lever for the broader integration that we're seeking in the Ontario healthcare system. So I personally have, I don't mean to be flippant, but I've drank the Kool-Aid. I believe in the model. That's why all these folks signed on 3 years ago because of that lofty objective. So I do believe in that, and it takes a while for a board to get their head around that significant change in their accountability. But I've converted, so to speak.
Great questions and great answers. Thank you very much. Any further questions? Seeing none, thank you very much for your presentation. May I have a motion to receive this presentation as information, please? Thank you, Councillor Van Riche. Seconded, Councillor Duffy. All in favor? Carried unanimously. Thank you. So we move on to the next adoption of advisory committee meeting minutes. 4.1 Health and Social Services Advisory Committee, October the 23rd, 2023. May I have a motion to approve the Haldeman Norfolk Health and Social Services Advisory meeting minutes from October 23, 2023 meeting? Thank you, Councillor Metcalf. Seconded. Councillor Van Passen, thank you. All in favor? Carried unanimously. Thank you. Update on reports. I think Sarah Page will provide us an update. Thank you, Sarah.
Thank you. Through the chair to committee, I have nothing to report right now. The last reports that went through Board of Health were approved.
Thank you very much. Are there any consent items? None. Staff reports, 7.1 Social Services and Housing, 7.1 Ontario Works one-time funding. Stephanie will present the report. Thank you, Stephanie.
Thank you very much. Through the chair to the members of the committee. Before I start presenting the report, I'm going to ask the program managers for the Ontario Works team who are here virtually to turn their cameras on so I can give them a quick introduction or reintroduction as it might be. So with me today, we have Chris Gilbert, Katie Donovan, and Chris Parker. They're the three Ontario Works program managers who oversee the operating the Ontario Works program for the service manager. And I'd also like to thank the three of them for their hard work on the service plan, the business plan that had to go through to the Ministry of Children and Community and Social Services in order to meet the very tight deadline that we had to meet and to get the approval for the funds. And I also would like to thank Michael Van Sickle, who is here with us today, our colleague in finance, for all of his hard work. He was pivotal in helping us get this through so quickly and to help us see the opportunities that were present for us. So I just wanted to thank the team and also to note that they are all here if there are questions that they can answer better than I can, because that is probably going to be the case. In September, the service managers, all of the 47 service managers across the province, were advised of an opportunity to apply for one-time funding through the Ontario Works program. The funding is for 2024. There was about a 2-week window for a business case to be presented to the ministry, and our approval was in October. So I know it says so in the report, but just to reiterate, this is why this did not go through the NBI process. It was past the deadline, and we were not aware of the funding opportunity until September. So we had to hustle to get this through. One of the challenges in the program is the lack of opportunity for scheduling tools. So you'll see that included on one of the one of the components for which funding was approved. The rest of it is a rather exciting opportunity that we started to pilot in September. We had made plans for this in the summer, and so again, we're not aware of the funding, but leveraged a little bit of opportunity within the budget to pilot community drop-in clinics across Haldimand and Norfolk for our Ontario Works programs. Very successful, lots of great feedback from community partners and from clients who are accessing the services. And so through this funding, we would very much like to continue to provide this and to grow it and enhance it throughout Haldimand and Norfolk counties into 2024. At this point, the funding would be noted until the end of 2024. I would very much like to continue beyond that and would make plans to do so should we be successful in getting the funding approval so that we can carry on through 2024 through community engagement surveys and so on and so forth. We're getting lots of details on what's working, what isn't, and adapting and evolving to ensure that we're meeting the needs of the community. And with that, I would be very happy to answer questions or have my colleagues answer the questions should they be the better ones to do so. Thank you.
Thank you very much, Stephanie. We have a question from Councillor Van Rishi. Thank you.
Thank you. Through you, Madam Chair. And I read it as what, 98,000 or something like that?
Through the chair, yes, that's correct.
Okay. And your intent there is to hire one full-time temporary?
Yes.
And this person would do what and why isn't it being done already?
Thank you. Through the chair to Councillor Van Rishi. Great question. Why isn't it being done already? Capacity. Through employment services transformation, as we're all aware, we lost quite a chunk of our funding and some of our staffing. And so one of the facets of employment services transformation is much more of a focus on life stabilization. COVID happened, and so that changed a little bit of our opportunity, well, somewhat, to get us out into the community. So now that things are moving forward, we've been thinking about this for quite some time and took advantage of an opportunity to pilot it with, like I said, some additional funding wiggle room that we had left in 2023 through our Ontario Works ministry envelope. So it was ministry funds that allowed us to do this, knowing that if we were successful, we would like to continue to do so, but it would probably be a modified level. When this funding came through, it gave us an opportunity to have an additional staff. So that staff would be overseeing and would be on site for many of our clinics throughout the community. When we have our staff go out into the community right now, they're in pairs. So 2 of our staff are in libraries and other community centers throughout the counties. And so although it's very important work, there's something that needs to give in order for that to happen. And so it's a little bit of trying to do more with the same amount that we've had. And so I hope that answers the question. It's just to make sure we have capacity to do it and to do it really, really well.
If I may, just a further question to that then. What exactly are they have the clinics, there's already 2 people there. This person would obviously rotate to the different clinics. And what would they specifically do, that extra person?
Thank you, through the chair. So what they're specifically doing now and what we'd like to enhance is they're on site to help people apply for assistance, get access to apply for housing, connect with our homeless prevention team, referrals to other community agencies, connect with people as quickly as we can to either prevent or support people who are experiencing crises, provide information or support or funding for food, hygiene items, and so on and so forth. So we're really seeing quite an uptake. Apply for ODSP, just really, you name it, it's happening, it's coming through. So be available for the needs. And then, as I said, the evolution is based on the information and the questions that we're getting from people. So we're moving in one direction, but something else is coming to the forefront. We'll be able to provide those services and support. The other thing that we'd like to do is partner with other agencies or with internal staff in our department to have them come with us and really expand and just be able to help meet the needs in the community. We talk a lot about meeting people where they are. It's an opportunity to do that and to really expand and to do that better, because the challenges of Haldeman Norfolk, as we're all aware, transportation as well as housing crisis and so on and so forth. And we could go on all day about the things that are happening. So it's trying to be creative, be supportive, and be flexible and fluid. So I would say that the vision for it is to learn as we go and grow and move in the direction that people are telling us through the questions that they have, through the services and supports that they need, so that we're moving in that direction to help them.
If I may, one more. And I've heard this from other municipalities, and I don't know how true it is or what it is, but at the end of the day, what they do is there's people with assistance, but they can't get the specific assistance that they need because they don't have an address, correct? So is there opportunity for Haldeman Norfolk to use their public libraries as the client's address so that they can get some of that public funding and use that to assist them? Because housing is, the dilemma is here.
Through the chair, that's a really good question. And the good news is that the Ontario Work staff have been doing that for our office locations for a number of years. For people who come in to receive assistance or apply for assistance, we've been able to use the home address of our offices so that they can get support. And then if that's not an option, the other thing that we're able to do is to support people in obtaining a trustee or another agency that could act on their behalf. So absolutely excellent point, and we're seeing more of that. Thank you.
Thank you very much. Councillor Duthie?
Thanks, Madam Chair, and through you. I am just curious, in the financial services comments, it talks about an ongoing commitment of funding, and I don't mean to quibble over $50,000 because it's not that much. However, it seems high to operate, from what I'm meaning, to be software. So I guess I'm just curious if you can explain that a little bit further.
Thank you. Through the chair. Good question. Software is very expensive, and unfortunately, it's really specialized software is part of the challenge. So the tool that we're using right now, it's called the Toronto scheduling tool, and it's decades old. I'm not sure how old it is, but it's decades old. And so what was happening is the opportunity for IT to support us with it, we were losing that ability. And so we've been informed that they can't support it. It basically won't function probably next year. And so what our internal IT colleagues started to do is see if they could build something in-house. They were not successful in finding that solution. We looked throughout the rest of the province. What are they using? What are the opportunities? And this particular scheduling tool, for which the funding is laid out, is very popular. It's used by Niagara and a number of other service managers. We were able to get a demonstration and so on and so forth. The nice thing with this is it doesn't just meet the need we had, it expands our opportunity to utilize. So we'll be able to use it throughout the entire department. So for housing, children's services, Ontario Work staff, there's opportunity to communicate and provide reminders and so on and so forth. The technology is a little bit more technical than I'm going to give it credit for, but at the end of the day, I would say that it's because it's such a large software tool and because it's so specialized. Those are the rationale for the technology company on the cost. Unfortunately, things are expensive. We have looked for all different options. We've landed that this is the best option available. It's just, unfortunately, it does come with a price tag.
Thank you for that. Any further questions? Seeing none, can I have a motion to receive the one-time funding 2024 HSS 23065 report be received as information, please? Councillor Linden, thank you. Seconded. Councillor O'Neill, I think seconded. Did you? Yeah. All in favor? Carried. Thank you. We'll move on to under public health, 7.2.1, Haldeman Norfolk Health Unit Annual Report and Attestation. Item number 7.2.1, HSS 23061. Saeed will present this report. Thank you.
Thank you. Through you, Madam Chair, I would like to introduce Michael Wensickle, Senior Financial Analyst, to present this report. Thank you.
Thank you, Syed. Through the chair to committee members. Report HSS 23061, along with the Ministry of Health report in Appendix A, summarizes the Haldeman Norfolk Health Unit's operations for the 2022 calendar year. This is an annual report that the Ministry of Health requires boards of health approval for submission per the Ontario Public Health Standards and Public Health Funding and Accountability Agreement. The report contains both financial information and program narratives and indicators. For the financial considerations, the report is broken down between base, one-time, and COVID-19 programs. For base programs, there are the 70/30 cost-shared mandatory programs and the 100% funded Ontario Seniors Dental Care Program. Due to the shift of staff moving to work on COVID-19 related duties, mandatory programs had a significant surplus when compared to the budget of just under $2 million. The Ontario Seniors Dental Care Program had a shortfall of around $70,000. However, that was eligible to be covered by the ministry. For one-time programs, the Public Health Inspector Practicum Program funding was fully utilized. The Smoke-Free Ontario Tablet Upgrades and Needle Exchange Program both had the full allocation carried into 2023 to be spent by March 31st. The Strategic Option Analysis Project received approval to be carried into the 2023-24 fiscal year, and the Ontario Seniors Dental Care Program deficit was funded by the ministry. For COVID-19 programs, the School Focused Nurses Initiative had a surplus due to turnover and staff returning to mandatory program positions. The COVID-19 response program saw a significant surplus due to budgeting on the expectation that costs in 2022 would be similar to previous years. The vaccine program, which was budgeted in the same way, had a surplus closer to the approved budget. For the levy, the full 70/30 mandatory program cost share had to be utilized before COVID-19 programs could be 100% funded by the ministry. For this reason, the levy had to support a portion of COVID-19 costs. However, since mandatory programs were significantly underspent, there was a shared municipal surplus of just under $400,000. The recommendations ask for the chair of the Board of Health to sign the annual report for it to be submitted to the Ministry of Health. And if there are any questions, staff would be happy to take them. Thank you.
Thank you very much for your report. Is there any questions? Councillor Van Passen.
Yes, thank you, Madam Chair. More of a comment. This is the most meticulous report I've ever seen, but I'm sure that Mr. Van Sickle had it right down to the penny, and it probably annoyed him he had to round it to even dollars. So, but very well done, very well laid out. Even the logic behind every little missing dollar or excess expenditure is listed in there. And, you know, I'll probably read it again when I can't sleep at night and need something to put me to bed. So thank you.
Thank you, Councillor Van Passen. That was great analogy of this report for sure. So if there's no further questions or comments, may I have a motion to approve the Haldeman Norfolk Health Unit Annual Report Notation HSS 23061 be received as information? Thank you, Councillor Van Passen, seconded by Councillor Metcalf. And that the report of Board of Health endorse the chair of the board to sign the 2022 annual report and adaptation, and further that the signed report be submitted to the Ministry of Health. So all in favor? Carried unanimously. Thank you very much. Next is 7.2.2 Vector-Borne Disease Program Update HSS 2302. Saeed, if you could introduce Alexis Sacketson, she will present. Thank you.
Thank you. Through you, Madam Chair, I would like to introduce Ms. Alexis Atkinson, Program Manager for Environmental Health Team, to present this report. Thank you.
Good morning. Through the chair to the members of the committee, I will be presenting the Vector-Borne Disease Program Update for 2022-2023 HSS 23-062. The Haldeman Norfolk Health Unit asks that this report be received as information and that the Board of Health supports the Haldeman Norfolk Health Unit's vector-borne disease activities, including active surveillance and education for prevention strategies. Vector-borne diseases are human illnesses that are caused by bacteria, viruses, and parasites. These illnesses or infections are transmitted to humans by vectors such as mosquitoes, ticks, flies, sandflies, and fleas. Mosquitoes are known to be responsible for transmitting the majority of vector-borne diseases. Haldeman Norfolk Health Unit's comprehensive vector-borne disease program is in place to monitor local tick and mosquito populations for diseases such as Lyme disease, West Nile virus, Eastern equine encephalitis, and Eastern equine encephalitis. This report highlights the public health initiatives that encourage the public to take preventative measures against tick and mosquito bites. Furthermore, there is a discussion of vector-borne disease program activities in the previous year and an overview of plans for 2024. Lyme disease is an infectious disease caused by the Borrelia bacterium that is transmitted to humans by the bites of infected deer ticks. The most common signs of infection is a bullseye rash on the skin. In 2022, the Haldeman Norfolk Health Unit identified 2 new risk areas for Lyme disease within Haldeman Norfolk. The 2 new risk areas were found through active tick surveillance near the towns of Port Dover and Jarvis. In 2022, there were 27 human cases of Lyme disease identified within the Haldeman Norfolk Health Unit compared to 26 human cases identified in the previous year and 7 in 2020. In 2022, there were 1,455 reported human cases of Lyme disease in Ontario. Warmer temperatures are thought to be responsible to increase the incidence of Lyme disease through increased tick maturation rates and longer available season of transmission. West Nile virus is a virus mainly transmitted to people through the bite of an infected mosquito. In 2022, 6,218 mosquitoes were collected, 3,114 of them were identified. From these identified specimens, 140 pools consisting of 1,326 mosquitoes were tested for West Nile virus. In Haldeman and Norfolk, there were no mosquito pools that were tested positive for West Nile virus in 2022. Provincially, there were 89 positive mosquito pools identified. In Haldeman, Norfolk, there were no human cases of West Nile virus identified in 2022. In 2022, there were also 29 reported human cases of West Nile virus provincially in Ontario. Eastern equine encephalitis is also known as sleeping sickness, is a disease that is spread to humans and horses by mosquitoes. In Haldeman, Norfolk, no human or equine cases were identified in 2022 or 2021. Provincially, no cases were identified in 2022, and in 2021, there was 1 case identified. Like West Nile virus, Eastern equine encephalitis is influenced by temperature and precipitation. Therefore, activity will vary greatly per year. Additionally, there is a vaccine available for the equine population, influencing the number of equine cases reported each year. Under the Ministry of Health's Ontario Regulation 135/18 and 569, anaplasmosis, babiosis, and Powassan viruses became diseases of public health significance on July 1st, 2023. These diseases are transmitted through black-legged ticks. Due to climate change and expanding rates of black-legged ticks in Ontario, the risk of contracting these tick-borne diseases is expected to increase. In 2023, Haldeman and Norfolk counties had no reported cases of these diseases. Plans for 2024 include efforts to increase public awareness about vector-borne diseases. The environmental health team will also be working with the communications department to ensure delivery of educational messaging through radio, social media, newspapers, the HNHU website, and smart TV ads, and develop promotional campaigns to raise awareness and build supportive environments to prevent and mitigate mosquito bite exposures. The Haldeman Norfolk Health Unit is also working with the county's Parks Department to ensure the availability of tick warning signs in tick-prone areas, as well as regular communications to local hospitals and physicians to increase awareness of the potential of Lyme disease infection in our area. In conclusion, the vector-borne program will focus public health services required to protect the health of the community. The key is education of the community with the goal of minimizing the likelihood of exposure to mosquitoes and tick bites. Thank you.
Thank you very much for your report. Is there any questions from the committee? Thank you, Councillor Van Riesche. Go ahead.
Thank you. Since we have lots of ticks around our area, I've been exposed myself. Is there anything recommended for households or people living in the countryside besides cutting your grass? I'm a proponent of low grass. My husband is not, but and we have cedar trees. So our cats and dogs, I mean, we have preventative medicines. But is there anything recommended to spray on your yards at all, or am I right off the mark there?
I don't believe there's anything to spray on yards anymore. But one thing that you can do is if you're going into a tick-prone area, you can wear appropriate clothing, make sure that your pants are tucked into your socks. Some people put tape around the bottom of the pants as well to catch any ticks from traveling up.
Yeah. Thank you. Councillor Van Passen?
Yes, thank Madam Chair. I think I've asked this question in the past, but if we recognize that ticks are endemic to Haldimand, Norfolk, mosquitoes are endemic, why do we waste money trapping them and identifying them? And shouldn't more of those resources be put into education and not waste our time dragging for ticks? We know they're here.
Thank you very much. It's surveillance is to determine trends in the future as well. There's 3 new diseases that have been added to the diseases of public health significance. And so that in combination with our infectious disease team can essentially tell us where those risk areas might be. It's to monitor for trends. And then when we see these trends, we can then direct education to specific priority populations that may be affected by these diseases in certain regions. So this year in 2022, we added Port Dover and Jarvis. So now all of Haldimand, Norfolk is included in the risk area, but for many years, those 2 areas were missing. Now we know that they're there. Also, we can help with surveillance in terms of the climate change. So warmer temperatures have been thought to increase tick populations as they don't die off in the wintertime. Also, the bacteria within the tick is supposed to help the tick survive through the winter. So it's a good thing to monitor our tick populations and mosquito populations to help curb viruses and disease in the future.
Yeah, but I think I've mentioned before, like it's not a geographic area. You know, if you're going to go walk across a plowed field in the countryside, you're not going to get ticks. You go walk through the grassy meadow, you're going to find them. So again, anytime you want to go check some, just go out to a hayfield and drag that. You don't have to go looking anywhere, any particular geographic area of Haldimand, Norfolk. It's the actual what's on the ground that where you'll find them. So anytime you want some, just come over. I'll show you where to go catch them. Right, so you can test them for your other diseases.
Thank you very much for your comments, sir. I understand.
I think you're sharing. Norfolk County is now sharing with Haldimand because we only had a couple of areas, I think, in Haldimand County where they were inundated, and then now it's moving into Jarvis. So thank you for sharing. I have a question too. Has the testing improved for Lyme disease? I know many years ago, the United States had better testing and better treatments. Are we catching up to the United States with treatments and testing?
Thank you for your question. I'm going to defer this to Dr. Locke.
Well, I beg to differ on that point through the chair, through yourself. Yes, first of all, I would firmly state that Ontario has internationally high standards for testing for Lyme disease. We probably have some of the best testing in the world. I'd question some of the testing that was done in other international, in other settings. So yes, we have an absolutely excellent testing protocol for Lyme disease. There are some there's been a lot of education done for primary care providers in that testing is not required. It's not helpful no matter what test you use on this planet in the initial period. The testing is really, in the initial period, your assessment is made based on the risk of Lyme disease within a certain geographic area. So for instance, that's again why the tick dragging is so important. We need to know where the ticks are and where people get bitten, because it does make it's a significant contributor to making a clinical decision about whether that person may be at risk for getting Lyme disease from that tick. The other issue that the clinician has to assess is not only where the tick bite occurred, but how long the tick was attached for. So if the tick was attached the greater than 24 hours, then there is a tiny risk of getting Lyme disease. The risk really doesn't begin until after 72 hours of attachment. So there's that's why it's important for members of the community to do a tick check after they've been out in a tick area, because then if they find it right away, then they can remove it right away and decrease the risk of Lyme. Also, if they don't see it on their body right away after they went there, then they have some idea, if they find one later, that it might have occurred in a different setting than they first suspected. So those two issues are the issues that are required to make a clinical assessment in the early stages for Lyme disease. Testing does come into play later on. So besides getting the typical rash that you get from a tick bite, if you go untreated, so you had a tick bite and you never were aware of it, and you much later on get symptoms that might be due to your cardiovascular system, to your neurological system, to your joint system, then we have to think, is this Lyme disease, or is this, let's say, rheumatoid arthritis? Let's say you got it in the joint. At that point, which is usually these diseases show up, 6, 8, 12, 2 years, 12 months or 2 years after the initial bite. At that point in time, the test is required. And at that point in time, the test is really reliable. They do not only one test, they do 2 tests in series to make the correct decision. And by doing 2 tests in a row, you increase the accuracy.
Thank you for that information. Appreciate that. Is there any other questions or comments? Seeing none. Thank you very much for your report again. So we will get a mover to approve this, please. Thank you, Councillor Van Riesche, seconded by Councillor Duthie. All in favor? Carried. Thank you.
Thank you very much.
We will move on to item number 7.2.3, proposed 2024 Haldeman Norfolk Shared Service Budget, HSS 23064. Saeed will introduce staff. Thank you.
Thank you. Through you, Madam Chair, I would like to introduce Michael Van Siegel, again, Senior Financial Analyst, to present this report.
Thank you, Syed. I apologize in advance. The board will have to bear with me as this might take a few minutes. Apologize, Councillor Van Passen. Through the chair to committee, the proposed 2024 shared services operating budget has been prepared with limited increases required to operations. New services requested include in-year 100% funded ministry programs previously approved by Council or the Board of Health, a partially funded initiative just presented to committee by Stephanie a few moments ago, and a Norfolk County funded housing initiative approved during the previous year's budget deliberations. Large swings in budgeted expenditures exist. However, for the most part, these fall within ministry funded programs and therefore do not affect the shared levy. This report overview will follow the flow of Appendix A in your package. Beginning on page 3, the Haldeman Norfolk Shared Services Budget summary shows the total increase for services. The proposed shared levy is increasing by $368,000 or 3.6%, with Haldeman supporting $108,000 and Norfolk providing $260,000. The base budget alone is a modest increase of 0.4%, with the majority of the increase relating to approved and previously proposed initiatives. The base FTE reduction is a result of ministry-funded COVID-19 programs ending December 31st, 2023, inclusive of the general and vaccine programs. Additionally, the school-focused nurses program ended June 30th, 2023. There are 8 additional FTEs from 2023 council or board approved initiatives with no levy impact, and 1 proposed initiative funded at 50% with 1 temporary FTE. So starting on social services. Social services begins on page 4 and consists of the Ontario Works and Children's Services budgets. Program overviews have been provided for committee information with financial details beginning at the end of page 5. The Ontario Works program can be financially discussed and broken down into 2 areas, administration and client benefits. Children's services includes childcare and early on programs. Large program adjustments occur based on ministry guidelines, local program uptake, and available funding. For social services, many of these occur within services and transfer payments and largely do not impact the shared levy. Top levy drivers have been included on page 7. The largest of these is employment-related expenditures, where costs for client employment services continue to rise without an adjustment made in funding to support these escalations. The next driver is the initiative discussed earlier today, followed by salary and benefit contract increases. Tables 1 through 3 outline the expected ministry share of costs against the actual share. The 2018 funding freeze on Ontario Works administration continues to drive the levy increases, with the cost share shifting year over year unfavorably against the municipalities. Childcare remains at the minimum requirement, while early on has improved on the levy ask, reducing to a minor requirement for the 2024 budget year. Year-over-year municipal costs share changes are included in tables 4 and 5, with a brief description of how costs are divided added for reference. A brief summary of the new budget for a senior case management scheduling tool, as Stephanie discussed, follows on page 9, with the overall summary concluding the Social Services Department with a requested increase of $221,300 or 9.1%. For housing services, summaries and overviews are included on page 11, with financial details starting midway through page 12. Similar to social services, large swings in base budget funding affect a few areas. However, these are offset from changes within federal provincial grants. Due to how the infrastructure funding approved initiative is presented, Norfolk's portion is decreasing in the base budget and being net out in the initiative. The largest driver in housing services this year is the provincial investment in the homelessness prevention program, which doubled compared to the planned allocation received in 2022. This has significantly helped housing services to continue one-time programs previously funded through the Temporary Social Services Relief Fund. Other programs have been adjusted based on planning allocations. Programs continue to be 100% funded by the ministry, while administration remains a levy cost. The investment of $125,000 by Norfolk for HNHC repair and renewal is driving the levy increase due to allowable recoveries to fund administration costs. The next largest driver is a decrease to the levy. The final large driver are housing provider budgets, which have been adjusted based on ministry indices. Table 6 shows the cost share for housing providers, with the ministry funding mortgage costs until maturity. This share will continue to increase on the municipal side as the final federal legacy mortgage payments mature in 2028. As mortgages mature, Housing Services looks to keep those units in the program through capital funding agreements. The ministry's Canada Ontario Housing or Community Housing Initiative comes into play for funding these capital costs. Table 7 provides the year-over-year change in municipal cost share for the levy. A summary of the council-approved initiative is next, with the overall budget for housing services concluding this department summary on page 16. The net levy increase for housing services is $47,300 or 1.1%. Next is the health unit summary, which begins on page 17 with the department budget. The health unit is further broken down by ministry-funded programs for committee and the Board of Health's information. So Ministry of Health programs starting on page 18 show that the health unit continues to recover from the pandemic. Top levy drivers begin on page 21, with salaries and benefits continuing to be the largest driver. For 2023 and 2024, the ministry has provided a 1% funding increase to mandatory programs. While not enough to cover salaries, this has helped to reduce the burden. With COVID-19 programs reducing significantly, corporate charges based on time spent on health unit work have also reduced, helping to decrease the levy impact. The ministry has confirmed a return to a 75-25 cost share from the previously reduced 70-30 share. Without any additional information on this, the one-time mitigation funding is now reflected as permanent and has been conservatively budgeted for based on the 2023 allocation. Despite the base funding increase of 1%, there is a significant gap between what is needed to run at a true cost share to what is provided as shown in Table 8. The municipal cost share is included in Table 9 and is based on the most recent information for the number of households in each county. Two summaries of initiatives for ministry-funded programs follow, with the Ministry of Health programs budget concluding this section. These programs are requesting an increase to the levy of $51,900 or 1.6%. For Ministry of Children, Community and Social Services programs, currently that just includes the Healthy Babies, Healthy Children program. The summary for this begins on page 25. Base program adjustments drive the levy increase without any changes to funding. The funding shortfall is outlined in Table 10, and similar to Ministry of Health programs, the levy cost share in Table 11 is based on the number of households in each county. The HBHC program has not received a funding increase since 2014. Due to this, any increase in expenditures will, percentage-wise, be a large increase on the shared levy, while the amount may not be as substantial. This is the case on page 28, where a $47,500 increase is equal to a 63.2% levy adjustment. For COVID-19 programs, there will be a report discussed later, but they are on page 29 and have been removed from the budget as a result of the previously approved board initiative. This is resulting in a large expenditure and funding and FTE decreases that can be seen on page 30. And that concludes this presentation for the proposed 2024 Haldeman Norfolk Shared Services operating budget. Staff recommendations include that the budget be endorsed by Norfolk County Budget Committee for Social Services and Housing Departments, and for Board of Health that the Haldeman Norfolk Health Unit budget be endorsed for them. Should committee provide any alternate recommendations, they would be included in those respective budget discussions. And staff would be glad to take any questions. Thank you.
Thank you very much for your report. Do we have any questions for Michael? No, seeing none, you present very well, Michael. You're very thorough, so appreciate that. May I have a mover to approve the proposed 2024 Haldeman Norfolk Shared Service Budget HSS 23064 be received as information, and that the levy supported amounts for social services and housing services be endorsed for inclusion in the proposed 2024 levy supported operating budget for Norfolk County, and further that the proposed 2024 Haldeman Norfolk Health Unit operating budget be endorsed and forwarded to the Board of Health for approval. Moved by Councillor Van Passen, seconded by Councillor Van Riesche. All in favor? Carried unanimously. Thank you. Now there is no, sorry, Councillor Van Passen.
Yeah, just a quick comment. Like, these are one of these budgets that, like, there's so many mandatory programs from the province. It is what it is, unless we want to have a very long, fulsome discussion on doing things differently or getting the province to allow us to do things differently. So, you know, what can we do? This is what it takes to fund the programs we are required to fund. So I wish all budgets were this quick and easy, right?
Exactly. There's none under subcommittee reports. Under communication, 9.1, Alpha November info break. This was information only. Do you have anything to add to that, Dr. Locke?
We just want to bring it to people's attention, and that's it.
Appreciate that. Thank you very much. Under the other business is 10.1 terms of reference review. Are there any committee members that would like to discuss this item? None? May I have a mover that the Haldeman Norfolk Health and Social Services Advisory Committee hereby recommend Norfolk County Council that draft revised terms of reference be approved as presented? Moved by Councillor Metcalf. Can I have a seconder, please? Councillor Duthie. All in favor? Carried unanimously. Thank you. There are two items under closed session today. Oops, three, sorry. Can I have a mover for the following motion that the committee enter closed session at 11 o'clock a.m. pursuant to section 2392 of the Municipal Act 2001 as amended, as the subject matter pertains to personal matters about an identifiable individual, including municipal or local board employees, labor relations, or employee negotiations. Can I have a mover, please? Thank you, Councillor Duthie. Seconded. Councillor Metcalf, all in favor? Carried. Thank you.
Welcome to Passionate Folks. I'm Emily. I love to dig in people's life, ask questions, and learn about people's passion. Today I'm here with Adam. Hi, Adam.
Hi, how are you doing, Emily?
Great. I'm happy that you're here, taking the time to sit down with me today. So I've known you for a little bit, small community, but people that don't know you. Tell me a little bit more about yourself.
So my name's Adam Van Passen. I grew up here in Norfolk County. I was born onto a farm and I got to work on that farm growing up, which was a great learning experience. From a young age, I got to understand what hard work was and what it was to be close to nature. So that was very cool for me. Growing up like that, my dad also was a counselor for Haldeman Norfolk, and he had a big part in shaping what is today Norfolk County. So I got to see that, and watching him and experiencing him work through that really sparked an interest in me for the county and what it could become.
Great. So not like the typical kids. We hear most high schoolers like just ready to get out of their hometowns and go explore the city and something else, and it doesn't sound like that's your story.
Not at all. I heard a lot of kids saying that they wanted to move on to bigger, better things, and I just really didn't have that feeling. I always thought the biggest, best things were here in Norfolk to start.
So I asked you to pick a location today, and you bring me to a place that I don't know very well in Norfolk. Yeah. So tell me about where we are and why you picked it.
This is a very cool spot. I know a lot of people drive by it, maybe on their way to Long Point or into Port Rowan, but this is Boose Harbor. So I grew up on Boose Harbor. My best friend, his family owned this place. So I grew up here hanging out, relaxing, boating, going out fishing, going out hunting. I worked here for a while. I did some volunteer work for the Shriners Club here, doing some chicken barbecues. So I really got to experience Norfolk and how community comes together. There's a lot of people that take up their summer residence here in trailers, and it's very cool to see all these people that are coming from other places in Ontario to enjoy what Norfolk has to offer. So it's just very cool to see that and experience it. One very cool fact about this place is that Boose Harbor has the largest amount of indoor boat storage on boathouses for all of the world.
The world?
Yes.
Wow, that is crazy. This little place.
Yes, absolutely.
Very cool. Something to be proud of.
I would absolutely say so.
So we've been talking about nature, and we spend lots of time outside. You bring me to a boating place where you like to fish and spend time. So tell me about your passion. Obviously, there's a connection somewhere there.
Yes, absolutely. Especially recently with everything that I've been seeing happen in the world, I'm very passionate about the earth. So I want the earth to be a good place. I want Norfolk County to be a good place. Everything that I love about Norfolk has to do with outside, has to do with nature, has to do with clean water, clean air, fresh trees, everything. So I just really think it's important to take care of everything that we have here in Norfolk County, and it's not an easy thing to do. So
no. We all have to start and do our part. That's the thing, right?
Absolutely. And I'm doing my best, but it does get very difficult. It's easy to make the change. It's just hard to start.
So we were talking earlier about, doing things around Norfolk and visiting places. I know you're a busy guy, like you work, you're a volunteer firefighter. So what do you do to de-stress and relax?
I would say my number one most favorite thing to do to de-stress would be to just get out on Lake Erie. Whether that's ice fishing, boating, swimming, relaxing. It's just such an amazing place. As soon as you get out on Lake Erie and you get away from shore a little bit, you just come out to this different zone.
Other than this place, like where else do you like to visit in Norfolk County? Where else? What's one of your other favorite spots?
I would say that my favorite spots in Norfolk County would have to be broken into two categories. One is nature, being Lake Erie, boating, all of that kind of fun outdoor stuff. And I also like Norfolk's bounty. Before, maybe you had to go out to a place far away to enjoy all of this beer, wine, food, amazing service, but now we can just go out the back door, and before I can drive for 10 minutes, I found something that I can go to locally that's amazing.
Couple of winery on the way here.
Yeah, it has passionate folks in it doing things. Like, it's just great. All around here, there's so many amazing things you can do, and it's just growing, so I love seeing that.
I thank you so much for your time. I love your connection with nature and what you want to do as far as your passion with the environment. I'm in line. We need to come together for this to happen, so hopefully we can inspire a few people with this little conversation here. So
Absolutely.
Thanks, Adam.
Cool. Thank you very much.
We'll see you soon.
Yeah.
Welcome to episode 7 of Passionate Folks. This is a blog and video series about the people who live right here in Norfolk. I sit down with them, have a conversation, ask them about their stories, their passions. I'm excited to present the next guest. Welcome to Passionate Folks. I'm Emily. I love to ask questions and get to know people better. Today I'm here with Dan. Hey, Dan.
Hey there, how are you?
Great.
Excellent.
Might be you stop by for coffee?
Yeah, well, nice of you to have me. I'm really delighted.
So we already had a good chat, but for people that don't know you, can you tell us a little bit more about you, where you live, and what you do?
Yeah. My name's Dan Fewings, and I was a Simcoe boy, an SCS grad growing up. From 0 to 18, I lived in Simcoe. And then I think I lived in Brantford for a year, lived in Dover for a bit, and then followed a gal up north to Peterborough, or Lindsay, and I ended up spending 28 years there teaching high school. Loved every minute of it. A bunch of different experiences. And when I retired in 2014, I thought, my ma's not doing so well down there. It's going to need some attention. And also followed a friend here, and bingo. And now I live just outside of Simcoe, in between Simcoe and Victoria on Highway 24.
Great. I'm so glad you took time to have this little chat. I want to go know more about you today, and I'm going to have you asking some questions.
Yeah.
But first, I ask you to pick a spot that means something to you in Norfolk. So maybe start by telling us where we are and why you picked this place.
Well, I love this place, not only for the food, although in my new machination I'm more careful what I eat, so I only have one crepe a week. But I love this place because Jim and Penny, the owners, are good friends. They've hired me to play here. They give the artists freedom to be a little zany here. They're good to their staff. They run a good ship. And I love the outside in the summer. It's rocking. They do a great job getting lots of music in. I think they have music all July, August, and September, like a whack of things. And I also, a few neat experiences sort of got born out here. I have a character, I do the song chef, and they were like the first ones to say, oh, you've got to come in and do it. So.
I love what you're talking about. Like, you're involved in so many things into your retirement that you seem to really enjoy the art. Is that the main thing you're passionate about, or?
Well, I like joy spreading, and the most rewarding thing I think I do is my gal Rosie and I, after we had a trip to Newfoundland, and after I did a tour of Newfoundland, we picked up on the kitchen party notion, and so we have a little duet called the Kitchen Party Orchestra, and we go to the seniors' homes and the respite center in Hagersville and Simcoe, and we give them the folks their instruments to play with us, so they're part of it. They're getting some exercise, and like that is joy spreading 101.
So spent a lot of time away from Norfolk, decided to come back to Norfolk in your retirement. So tell me, like, if you don't have a gig, if you're not involved in something, like, what do you do to hang out, to relax? Where do you like to go?
Well, I love the geography, so I always like going down to one of the many shores while there still exist.
Yes, Port Mercy's a little small this year.
Yeah, oh my gosh, yeah. I love, and
are you a beach guy, or?
Not in the summer, I'm not, but I am, sort of going to the water for answers kind of a guy. Okay. You know what I mean? Yep. The Leonard Cohen dimension. And so Long Point was always like hugely special as a kid, I spend a lot of time at the Simcoe Little Theater. That's a great organization, and they're doing fun and they're welcoming. And so I'm gonna play coming up that I'm doing, and
You don't seem to have too much downtime. Like you seem to keep pretty busy.
keeps me out of the housework. That's for sure.
You got out of the older.
He's all busy, making some ass right now. You know, sewing. You know.
Yeah.
And so.
Is it hard to get artists to come and play here? Or people are they curious about wanting to see Norfolk and see what this is
you know
about,
what? Like more people, like house concerts are amazing too. Like and I was never a musician on the road. I did 2 1-month tours with a student, and I had a buddy of mine, Jimmy Boskill, who was a student of mine. He said, "When you retire, we're going on tour." My son is in a band, the May Hemingways, so he traveled lots east. So he booked us from Peterborough to Newfoundland, 24 gigs and 26
all the
nights.
way, or?
Both, you know, but you make, you know, as a musician, you make way more at a house concert and play more concerty, less with people listening.
No.
People love to play, right? So oftentimes people think you need the applause as much as you need the money. Yeah. And many people are lined up. So it's like, you don't want to do it? That's okay. I've got Tiny Talent Time and his brother here that'll play for you, you know? And so people, that's why it's so nice to be in a place like this where you know that their entertainment budget is a really significant amount of money. And there are a lot of places in town here. The 211 does it as well. Even the Norfolk has a whack of music. And it's getting bigger around here with all the, you know, with the craft beer industry, the wine industry. All those places are looking for some entertainment to get their clients in. So I think it's, you know, it's going to be significant. It's just a tricky game.
So music, obviously a big part of your life?
It is a big part of my life. Yeah, I think I started when I was 13. My brother handed me a John Prine album, the very first one with him sitting on the hay bale and a guitar, and showed me the C, F, and G chords, and I never had a lesson after that.
You just learn on your own?
I just learned on my own. Guitar has, and stringed instruments often have tablature.
Yep.
Especially ones that have frets, so it's a grid really, so they can like it's easy on notation to put a number 1 on a 1. You know, you're at the first,
okay, you know
so it's an easier
so,
system. But what happened was I was working in the teachers union. I had been seconded out of teaching for a couple of years. The head of music was leaving to become a minister, and he said, "Dan, can you teach kids how to play guitar?" And I said, "Absolutely." And I said, "Now, Larry, you know I don't read music, right?" And, "You don't?" And I said, "No, but I'll buy tablature." So at any rate, made it work. And down the road it was funny because Jimmy Boskill, who was a wizard player, doesn't read music either. He had auditioned for this art school, and I was sitting at me, they weren't going to let him in because he didn't read music. And I said, "I should let you folks know, as you know, I don't read music." And I said, "If you're not letting this kid into the program, give me 2 weeks notice, because I'm not going to be the guitar teacher that wouldn't take him in." So you got to keep it moving.
Is that one of your favorite instruments? Like?
Yeah, this is, it's a Latin instrument. It comes from like the Andes, so Bolivia, Peru, Ecuador, Chile. It's usually used in like... But then I found, being sort of a folky dokey player too, it's like a good bluegrass instrument too, and it's like in the day and age of cutbacks, when the bluegrass bands start firing the banjo player and the mandolin player, you get both with one.
You show up with this one, you're good. You're good at drumming gig.
That's right.
Perfect.
And this is a charango, and it is higher up. So I started with one of these. And I'm a big fella, so it's, you know, and you don't need that strap, it sticks right in your belly button. Like, you couldn't peel that off with a grower.
All right, so you do some improv.
I do. So, like, give me a title to a song never before written. It can be anything.
Let's go with the Bikini Crepe, I guess.
Bikini Crepe?
We're here, the Crepe House.
Well, it's more appropriate on a day like today to not sing about martini. So let's think while we're in the land of sand about a crepe martini. No pina colada beside you now, knowing it's done somehow. Here comes the customer now. He's probably gonna order the crepe bikini. thing about the bikini crepe, it's teeny weeny, it's how they make. I'm not sure if it's a Speedo sauce, but it's nice all the same. Ah, it's teeny weeny, but it's my favorite, that old crepe bikini. Yes, sirree, I think he's making me one now. And it might be true that you can't wait for your bikini crepe, but that's okay. Got time on my hands. Right on.
All right, cheers, Sam.
Cheers.
Thanks for joining me. Have a coffee. That was
Absolutely.
awesome.
Right on.
Love it.
Good. Thank you very much. Great.
You're welcome.
See you later. Thanks, Drew.
Great,
guys. No, it's not possible. No, I cannot tell you what to say.
Soon after, members of council and I took our seats right here in council chambers last November, we began to plan the direction we'd like to see Norfolk County take over the next 4 years and beyond. A direction that builds on our strengths and sets a strong foundation in place for future generations. We looked outward to the people of Norfolk for input. We listened to you, the valued members of our community, from our sandy lake shores, our vibrant downtowns, our picturesque countryside, and our bountiful farmland. We engaged leaders from local businesses and community agencies. We gathered ideas from our team across the county. Based on what we've heard, we created Our Future Norfolk, a set of priorities that focuses on 5 key areas: empowering Norfolk, building Norfolk, connecting Norfolk, serving Norfolk, and sustaining Norfolk. These priorities, along with the initiatives and activities that drive them, will guide council and staff as we work together to serve you and all of the members of our community over the next 4 years. On behalf of Norfolk County Council and staff, we invite you to check out our website at norfolkcounty.ca/Our Future Norfolk and return frequently to learn more about our path to a vibrant and strong future for all of us, now and in the years to come.
Ride Norfolk is making it easier to get around Norfolk County. You can now book your ride by downloading the free Blaze Transit app on Google Play or the App Store on your iPhone. To get started, create an account and select Ride Norfolk as the transit operator. Select your location and your departure or arrival time. Make sure to check the schedule beforehand so your trip will be accepted. Trips can be booked 45 minutes to 7 days in advance. Pay for your trip using debit or credit in the Blaze Transit app. You can also book online at ride.blazetransit.com or by contacting Ride Norfolk customer service. For more information, visit norfolkcounty.ca/Ride Norfolk app or call our office at 519-428-3178. Ride Norfolk is going your way.
My name is Jim Toombs. I'm an Associate Purchasing Specialist here at Toyotetsu, also known as TTCA. Here at Toyotetsu, we're responsible for supplying Toyota with car parts, mainly automotive frame for the Lexus, the Corolla, and other Toyota models. I started here in May of 2016. I was in welding. Here I am 2 years later, and I'm a salaried position. The job itself it's challenging. There are challenges in what I have to do every day, and for that I enjoy it. It's not monotonous day in, day out. There's new challenges that I'm confronted with and new tasks that I have to do. A high school student who's like, I'm not sure, I think this is an excellent opportunity to kind of answer that question for themselves. They can see what kind of the working world is like, as well as pick up skills. There are plenty of opportunities here. For example, for me, I was in welding, but that didn't mean I had to stay there. There's opportunities in stamping, where you'd learn different skills entirely. PC, again, the same thing, some different skills needed that you'd learn. Though we make car parts and they're welded, there are a lot of departments and areas that support that.
My name's Aaron Pace. I'm a yard manager here at Townsend Lumber. We're a sawmill that produces lumber. We make anywhere from rail ties to timber frame home products, kiln-dried lumber, which is used for wood cabinets and furniture. We also do pallet components, and we also do stakes for farming. We ship container loads to the Middle East, we ship it to Asia. We have gone to Mexico, Singapore, we've shipped to many different locations. My father has worked here for 30 years. He got me a part-time job as a summer student. I started as a regular piler, as a laborer at the entry-level position. And with hard work and dedication, I have been promoted through the system, and it took 9 years to become a supervisor. I enjoy the freedom of the job, like outside working with the heavy industrial stuff, talking to the range of customers and the way we produce things for them.
My name is Cam Kirkwood. I'm a production supervisor at Superior Essex in Simcoe. We make magnet wire and cable for the transformer industries. Our magnet wire products are found all around you that most people don't even notice, in winding motors, in alternators in your vehicles, transformers on the side of the road or on top of poles. I've been here at the company for 15 years. I started on the floor as a machine operator for 7 years, and then I did a stint in engineering for about a year, and then I moved on to production supervisor for the last 7. One of the best parts about working here is it is a build-to-order shop, so although we do make similar products every day, it's very unique. We don't always see the same orders. There's always new challenges. One of the best parts about being in manufacturing for me is the shift work. So it provides an opportunity for you to adjust to do your own life on your days off, or you can pursue other interests. A lot of people have second businesses or hobbies that they really enjoy. There is lots of opportunity to advance. There's educational assistance programs. You can continue to learn new skills and advance to a new area if you were so desire.
There's a great opportunity moving up the manufacturing sector.
Try it, because you're going to learn a lot about the working world as well as yourself.
Welcome to Passionate Folks, a blog and video series where I'll be highlighting people from Norfolk County who have a passion, who are involved in our community, who are the movers and shakers. So I'm excited to introduce every month somebody new from Norfolk that will bring you their story, their passion, and share it all with us. Come on in. All right, welcome to the first episode of Passionate Folks. I'm Emily, and I love to dig in people's life and getting to know more about them. I'm here with Jess today. Thanks, Jess, for showing up.
Thank you for having me. This is so exciting.
So Jess, for the people that don't know you, introduce yourself. Tell me a little bit more about you and the person that you are.
Sure. Well, my name's Jess, and I grew up in Waterford, more specifically Boston, more specifically Bill's Corners. I'm a passionate Norfolk advocate. I love this area. I love theater. I love music. I love anything arts related. Also a passionate advocate for entrepreneurs in the area.
So I invited you to pick a location in Norfolk that meant something to you. So tell us where we are and why you picked this place.
All right, we are here in Simcoe Little Theater. It's on the corner of Talbot and Yonge in downtown Simcoe. And this place, Simcoe Little Theater, is a very special place to me. I've spent most of my life in these walls, on that stage, behind the stage, in these seats, like everywhere in this space. It's something that theater is something that's like has always been a big part of my life since I was about 8 years old.
You mentioned to me that you also in high school, you were really involved into the drama program and all that, so.
I had walked the halls of my high school and I'd seen so many pictures on the wall of different shows they had done throughout the years, but nobody was doing shows anymore. And I was like really bummed about that. So in grade 10, me and my girlfriends, we roped all our moms in. We're like, if we start doing high school shows, like, will you guys help? Will you make costumes? Will you whatever? And they all jumped in.
Involved.
Yeah.
I love that, right? Like, that's a small community, like
that's
everybody coming in together.
And like, that's what it requires, right? Like a show is like a mini village coming together, like making all the pieces happen.
So this community, I think the word, like you keep repeating it, and I think what you're creating in Groundswell is that sub-community within the community, and that really stands out. So would you say this is something that you're really passionate about?
Oh yeah. Yes.
Yes, that connection,
totally.
right? Yeah.
I just think like community is everything. We're not meant to live life alone. I don't think. And I don't mean like you have to necessarily have a romantic partner to live a life, but just have people around you that get you. That you don't have to explain yourself. You know what I mean? You just walk in the room and they're happy to see you. That's it.
That's always such a good feeling. Isn't
Yeah.
it? Yeah, like you just have those people that believe in you too, right?
Yeah.
And just cheerleaders.
Yeah.
So I see, Jess, you're always involved in this community. Like you're volunteering places. You really want this place to grow and thrive. And so why Norfolk? And what do you love so much about this place?
Oh man, I think yeah, it's a really good question. It's a combination of things. I think the geography that we live in, the nature we have around us, that is a huge benefit of being in Norfolk. But it's also the people here, and that's why I'm so obsessed with community, because we have so many beautiful people who live here with ideas, with talents, with love and vision. And I think that's what excites me. It's like, just because we're a small town doesn't mean we have small ideas or small impact.
I want to bring some of the music piece, because I know we've been talking a lot about the theater and acting, but I know that music is so important to you.
Yes.
And a big part of your life.
Yes.
So tell me a bit more about your maybe influences and what makes you feel alive in music.
Just like theater, I love performing music too. There's something really cool about being on stage like that. Before I came here today, I was like thinking about how alive I feel when I'm on stage. And I think that everyone kind of looks for that thing that makes them feel alive.
Yeah.
So for me, it's that.
Awesome. So I thank you so much, Jess, for taking the time to meet with me. There's going to be more feature of passionate, uplifting community people through this little video series. So keep watching. Thanks, Jess.
Thank you. Oh my gosh. This is so much fun.
Awesome.
Soon after, members of council and I took our seats right here in council chambers last November, we began to plan the direction we'd like to see Norfolk County take over the next 4 years and beyond. A direction that builds on our strengths and sets a strong foundation in place for future generations. We looked outward to the people of Norfolk for input. We listened to you, the valued members of our community, from our sandy lake shores, our vibrant downtowns, our picturesque countryside, and our bountiful farmland. We engaged leaders from local businesses and community agencies. We gathered ideas from our team across the county. Based on what we've heard, we created Our Future Norfolk, a set of priorities that focuses on 5 key areas: empowering Norfolk, building Norfolk, connecting Norfolk, serving Norfolk, and sustaining Norfolk. These priorities, along with the initiatives and activities that drive them, will guide council and staff as we work together to serve you and all of the members of our community over the next 4 years. On behalf of Norfolk County Council and staff, we invite you to check out our website at norfolkcounty.ca/OurFutureNorfolk and return frequently to learn more about our path to a vibrant and strong future for all of us, now and in the years to come.
Ride Norfolk is making it easier to get around Norfolk County. You can now book your ride by downloading the free Blaze Transit app on Google Play or the App Store on your iPhone. To get started, create an account and select Ride Norfolk as the transit operator. Select your location and your departure or arrival time. Make sure to check the schedule beforehand so your trip will be accepted. Trips can be booked 45 minutes to 7 days in advance. Pay for your trip using debit or credit in the Blaze Transit app. You can also book online at ride.blazetransit.com or by contacting Ride Norfolk customer service. For more information, visit norfolkcounty.ca/Ride Norfolk app or call our office at 519-428-3178. Ride Norfolk is going your way.
Welcome to Passionate Folks, a blog and video series about the people that live in Norfolk, people that are passionate, people that are involved in their community, people that bring a lot of positivity. This is about story and conversation. Join us for the second guest. Welcome to episode 2 of Passionate Folks. I'm Emily. I love to ask questions, learn about people, get some connections. I'm here with Carrie today.
Thank you for having me.
I've been chatting with you and I got to know you a little bit more, but for folks that don't know you, maybe introduce yourself.
My name is Carrie Bokenholt. I live here in Waterford. I've lived here for over 15 years. I'm married. I got 2 kids, and I just love the community.
From our conversation today, there's a lot of the community word showed up quite a few times. So
I'm a believer of, when I moved into Waterford, I thought, wow, you know what, if we get involved, then you learn so much more and you meet so many different people. I mean, people that I know if I wouldn't have met otherwise.
Yes. So I asked you to pick a location, Carrie, and so tell us where we are and why you picked it.
I picked the Waterford Heritage Agriculture Museum, WHAM, because in a couple summers we will be building our skateboard park here. So it's kind of a let's do it all fun. Not that I wear the shirt or anything, but yes, this will be our future location on the other side.
Talking about passion and passionate people, what do you think your passion is?
My passion is youth. I love kids. You know what? There's no such thing as a bad kid. Kids make bad decisions. And as the old saying, it takes a village to raise a child. And I truly believe that, you know what? We give kids, that opportunity and show them that we support them and that, that we're there for them and they'll make the right decisions.
I made a stop at her business. She has a business downtown Waterford, and I was seeing that your family works there, your friends, your best friend is...
My best friend is with me. Both best friends, yes.
So this tight-knit community feel is really important.
When I was given my dream and somebody said to me, here, I'll help you, create your dream. And I thought, okay, karma. So this is somebody saying to me, it's my opportunity to use this to give back. If I have a restaurant, nobody should be hungry. I want kids to feel like they can come in and say, I need something or I need a drink or, whatever. I've been doing this for 30 years and the kids that I trained 30 years ago still come back to find me. And they come back and they tell me what they've been doing. And I guess the biggest thing is people don't realize sometimes the simplest thing can change a kid's life.
It is a ripple effect, don't you think?
It is, you know what? And I mean, so I get to see their, I feel old when I start seeing them coming with their kids. And I start seeing, that they've gone through and they're going to university or they're doing this or they've done this or done that. And it makes me feel like, I had a piece of that. Just by being involved in their life, maybe I made a little bit of a difference.
So you're an entrepreneur, you're super involved in the community, you're a mom, you have a lot on the go. So if I ask you, what do you do to de-stress and let go?
I like to go to the gym. I like to, boot camp, yoga. I try to take, a few hours a week for me.
Yes.
And it's just about me. And I honestly think anybody who's really busy, I think needs to learn. It took me 48 years to figure it out. But
never too late.
Never too late. As I said, I can go to the gym and I can be having the world's hardest day, and I always say I leave it on the mat.
Love.
So when I walk out of there, I feel like a completely, totally different person. Leave it on the mat.
So other than that, when you're in Norfolk, what else do you love to do? What's your favorite spot or place that you like to visit or something you love to do?
Love to go on the trails. I love going fishing on the ponds. Waterford, we have so many little places to go and see and do and
What's
stuff.
happening in this community?
You know what, there is. And I mean, the thing is we don't really, I laugh because there's so many of us who don't see what's here. They're right here. Whistling Gardens, Bonnie Heath. We have all the wineries and stuff. The museum. There's so many places to go. You can have a staycation without leaving Norfolk.
Yes. So thank you so much, Carrie, for joining me today and being part of this blog and video series. I invite you to check it on. Every month there will be somebody new, a new story, a new connection. Thank you so much.
Thank you.
Welcome to Passionate Folks, a blog and video series about the people of Norfolk. It's about people that have high energy, that get involved in their community. We sit down, have a conversation, learn about their passions. Welcome to the next episode. Hello, I'm Emily. Welcome to Passionate Folks. I love to ask questions and discover people's passion and having great conversations. So today I'm here with Nick. Hi, Nick.
Hi.
Might be you're here, might be you invited me to a great place. I got to know you a little bit more today, but I'd love you to tell us a little bit more about you.
Sure. So I'm Nick Pranks. I was raised in Langton, and I live in St. Williams now.
So Norfolk County boy.
Yeah, Norfolk County boy. Yeah. If you're gonna put a location on it, and if you're asking someone where you're from, this area, you always say Norfolk County.
No.
Unless you're from Port Dover.
Did you say Port Dover?
And then you say Port Dover for some reason.
I invited you to pick a place. So tell us where we are and why you decided to invite me here.
So we're at where I work, Blue Bear Hill Estates, which my family owns as well too. This is where I spend probably my entire day every day of the year. So we're located on the patio here, and we basically are overlooking the patch. And you probably cannot see from the camera because it's on the other side of the camera, but the lake is just on the other side.
I love to hear about people's passion, and I know you have a lot of projects going on, and I want to dig further into your passion. So what do you think really stands out for you? What are you really passionate about?
So day in, day out, I'm typically making wine or working the field, so that's something I'm really passionate about. I'm also the president of the Ontario South Coast Wineries and Growers Association, which encompasses Norfolk along with other neighboring counties. And so I'm really passionate about trying to raise awareness of this area for growing grapes and making world-class wines.
And so winemaking, like what draws you to it? Why are you making your whole life right now? And why winemaking in Norfolk County?
Well, I guess you could say it's one of the best agricultural products you can make.
I agree.
It's something that you can preserve, and like even after the crop is finished, you still have to work with the crop that you were working out in the field all year round. And when you put it in a glass of wine, you have memories of how that year was when that wine was made.
So it sounds like you spend a lot of time on this farm, a lot of time on this like part of Norfolk County, but if you have time to de-stress, where would you go? What do you do in Norfolk?
I definitely like going to the beach. So, getting out in the water when it's a hot day is truly nice.
Not too far from Turkey Point, I guess. You can roll down the hill.
Yeah, we got excellent restaurants here too, so which is pretty amazing for the per capita, the amount of people that live in Norfolk County, that we have enough restaurants that you count them more than your two hands or whatever, which is
really
nice.
Good ones too, right?
Yeah, exactly.
It's so exciting to see how our agro-tourism industry is developing in our area, and it's kind of cool to see you guys like working together and really promoting this area.
Well, when you think about farming from what it was in the past, it has to evolve over time though to make it an industry that can support itself. It allows people to be able to figure out ways to succeed or have succession in their family, to go to that next generation, so that way we can have countless more generations of those families living in Norfolk County, growing the things that their grandparents grew.
And keeping the passion alive.
Exactly, yeah.
I thank you so much for your time, Nick. I thank you for inviting me in this beautiful place. I cannot wait to explore some more. And
It's too bad it's not pizza day.
I know, I heard that was really good. I'll come back. I'll be back. Thanks, Nick.
No worries. Cheers.
Soon after, members of council and I took our seats right here in council chambers last November, we began to plan the direction we'd like to see Norfolk County take over the next 4 years and beyond. A direction that builds on our strengths and sets a strong foundation in place for future generations. We looked outward to the people of Norfolk for input. We listened to you, the valued members of our community, from our sandy lake shores, our vibrant downtowns, our picturesque countryside, and our bountiful farmland. We engaged leaders from local businesses and community agencies. We gathered ideas from our team across the county. Based on what we've heard, we created Our Future Norfolk, a set of priorities that focuses on 5 key areas: empowering Norfolk, building Norfolk, connecting Norfolk, serving Norfolk, and sustaining Norfolk. These priorities, along with the initiatives and activities that drive them, will guide council and staff as we work together to serve you and all of the members of our community over the next 4 years. On behalf of Norfolk County Council and staff, we invite you to check out our website at norfolkcounty.ca/OurFutureNorfolk and return frequently to learn more about our path to a vibrant and strong future for all of us, now and in the years to come.
Ride Norfolk is making it easier to get around Norfolk County. You can now book your ride by downloading the free Blaze Transit app on Google Play or the App Store on your iPhone. To get started, create an account and select Ride Norfolk as the transit operator. Select your location and your departure or arrival time. Make sure to check the schedule beforehand so your trip will be accepted. Trips can be booked 45 minutes to 7 days in advance. Pay for your trip using debit or credit in the Blaze Transit app. You can also book online at ride.blazetransit.com or by contacting Ride Norfolk customer service. For more information, visit norfolkcounty.ca/Ride Norfolk app or call our office at 519-428-3178. Ride Norfolk is going your way.
What if there was a place just outside the hustle and bustle, where the beauty of nature was right at your doorstep, inviting you to join in the fun?
Good job, guys. Got it.
What if there was a place where the landscapes were as diverse as the bounty they produced? And the term field fresh was more than just a marketing ploy. It was a way of life. What if there was a place where history and heritage shared the stage with technology and innovation, and success happened without much fanfare, on back roads, nurtured by wise and hardworking people? What if there was a place as lush as an ancient garden that was, for centuries, a place to explore, live, and play? A place of promises and hope. A landscape filled with possibility. And what if this wasn't just a place to escape to, but a place you could settle into? What would you call such a place? Well, we call it Norfolk County.
Welcome to episode 6 of Passionate Folks. This is a vlog and video series about the people of Norfolk. We sit down, have a conversation, hear about their passion and what lights them up. I'm excited to introduce the next guest. Welcome to Passionate Folks. My name is Emily. me. I love to connect with people, having some conversation and learning about people's passion. Today I'm sitting here with Sue. Hey, Sue.
Yeah, you bet.
I'm so glad that you took the time to come out and have a conversation with me.
Well, thanks for asking me.
Yeah, so for people that don't know you, can you start with introducing yourself, where you live, where you're from, and a little bit more about you?
Okay, sure. My name is Sue Downs. I live in Simcoe, born and raised here. And I work for the Simcoe Reformer newspaper and started there way back in 1988. So, and loved my job, loved Norfolk County, and was really pleased that Emily asked me to be part of this. I think.
So far, so good.
So far, so good. Yeah, so far, so good.
Great. So, as always, Sue, I ask a guest to pick a location so we can explore it and discover a hidden gem in Norfolk County. And this one is a little bit different. So, tell me where we are and why you brought me here.
So, we're at Norfolk County Fair. We're at the bottom of the Junior Farmers Building here.
So, why do you pick the fair? What's so special about the fair to you?
I think for myself, Norfolk County Fair is like one of the largest events that happen in Norfolk County every year. It's always been near and dear to my heart. Like I think so many childhood memories. It's all about tradition. For us growing up, at my age, I've only missed one fair in all of my years, and that was when I was in Timmins. So I just love the fact that you can come to the fair. There's so much excitement. There's always lots of things to see and do. Like family would come home during Thanksgiving weekend, and I think that still happens today, right? Like it's all about tradition and all about community, which I feel like I'm pretty passionate about.
Yeah, so I was just going to ask you a little bit more about your passion. I see you a lot being involved in the community and supporting local businesses, and it seems like it's really important to you and close to your heart.
I like to promote local as much as possible. So whenever we go out for dinner, a lot of people go, do you ever stay home? Because you'll constantly see posts on social media, on Facebook or on Twitter, and it's like, you know, we're at the Barrel, we're doing this, we're at Long Point Eco Adventure, we're, you know.
It's so good that you're taking the time to promote those local businesses and support. And I remember when I started my business, you were one of the big supporter of sharing what I was doing. And I know a lot of people have felt the love that you give to entrepreneurs. So I want to thank you for that.
Well, you're welcome. But it does make you feel good, and it is important. I feel that, you know, if we can, you know, support each other as much as possible, like it's again, it's all about giving back.
So Norfolk County and specifically Simcoe has changed quite a lot. We are moving in a different direction in our county. So from you like growing up in Simcoe and in the downtown and what's happening around now, like what's the highlights for you?
Okay, well, the highlight growing up was always, you know, going downtown on the weekend. People that are watching this that are my age would remember you used to be able to go to the Tartan restaurant and Woolworths and different places down there. But I think a lot of the exciting thing that I see now is a lot of the collaborations that are happening within Norfolk County. And one that stands out is, you know, Burning Kiln and then Long Point Eco. And then along came, you know, my buddy Dusty and the guys from Hometown Brew. And then now Joy Cafe out there. So it's really cool to see a lot of the business people working with each other and stuff like that too. So that sort of stuff.
You don't have to go too far. You show up there and everything that you love is right there.
It's like a lot of renewed, you know, it just seems like a lot of positive things are happening within our community, and it's really good to see.
So I know you have a pretty high-stress job, so maybe tell me a little bit more about what you do to relax, calm down, and look after yourself.
Okay, well, I do like to garden. I find that, you know, if you're kind of stressful in a stressful day, you get out there and take it out on all the weeds in your garden. I also like to, you know, walk along the trail from Davis Street and then head out along the 14th or whatever. And you can, like, it's heading right towards Waterford, so you can actually walk from there right into Waterford. I've got a dog that keeps me pretty busy, and then a group of like really good friends that we are going out with each other like all the time and stuff like that.
I know you have a lot of favorite spots in Norfolk, so we already named a few, but if you have a day off and you want to explore Norfolk County, is there one specific place that you actually love to visit that you feel just at home?
I would say for myself, it depends on the day. So if it's just something that I want to go and like, you know, do a walk or whatever, it would be my trail on the 14th because it is kind of private. There's not, you do run into a lot of the same people and stuff like that. I also like going down to Dover. I'll sit at the cafe and kind of look around there.
You can watch a little bit?
Yeah, you know, that sort of stuff, and then even take off and go to the pier. Actually, my mom has a bench there for my grandfather, who was a fisherman down in Port Dover as well too. So it's kind of nice.
Memorial benches.
Yeah.
Very cool. It sounds like pretty much everything you need is right here.
Why should I go out of town? Why do I need to go out of town? Yeah, I mean, there's a lot of stuff here that, right in Norfolk that we need use, yeah.
I'd love to hear your passion for Norfolk and how well you support the local businesses and just, I see you at fundraiser and you're always involved in your group of friends and supporting whatever is happening in the county. So we need more of you, Sue, in Norfolk. So thank you so much for joining me today and having this little chat. I'd love to get to know you better and hear more about your passions.
Well, thanks very much for allowing me the opportunity. It was great. Thank you.
Soon after, members of council and I took our seats right here in council chambers last November, we began to plan the direction we'd like to see Norfolk County take over the next 4 years and beyond. A direction that builds on our strengths and sets a strong foundation in place for future generations. We looked outward to the people of Norfolk for input. We listened to you, the valued members of our community, from our sandy lake shores, our vibrant downtowns, our picturesque countryside, and our bountiful farmland. We engaged leaders from local businesses and community agencies. We gathered ideas from our team across the county. Based on what we've heard, we created Our Future Norfolk, a set of priorities that focuses on 5 key areas: empowering Norfolk, building Norfolk, connecting Norfolk, serving Norfolk, and sustaining Norfolk. These priorities, along with the initiatives and activities that drive them, will guide council and staff as we work together to serve you and all of the members of our community over the next 4 years. On behalf of Norfolk County Council and staff, we invite you to check out our website at norfolkcounty.ca/Our Future Norfolk and return frequently to learn more about our path to a vibrant and strong future for all of us, now and in the years to come.
Ride Norfolk is making it easier to get around Norfolk County. You can now book your ride by downloading the free Blaze Transit app on Google Play or the App Store on your iPhone. To get started, create an account and select Ride Norfolk as the transit operator. Select your location and your departure or arrival time. Make sure to check the schedule beforehand so your trip will be accepted. Trips can be booked 45 minutes to 7 days in advance. Pay for your trip using debit or credit in the Blaze Transit app. You can also book online at ride.blazetransit.com or by contacting Ride Norfolk customer service. For more information, visit norfolkcounty.ca/Ride Norfolk app or call our office at 519-428-3178. Ride Norfolk is going your way.
I am Tom Pursley. I work at Titan Trailers. I manage the shop and design, build, program robot cells on the floor to hand off to operators to build trailer components and assemblies. I knew I always wanted to work with my hands growing up as a kid. I never wanted to be stuck behind an office doing paperwork for the rest of my life, and it really interests me to build something and see the final result when you're done.
My name's Angela Simon and I work for Annex Business Media. We are a trade magazine publisher. We produce 65 trade magazines for a diverse industries, so everything from aviation to firefighting to design engineering, manure. We have a very diverse set of magazines that we produce. I'm the production manager and I oversee the creative department in 2 divisions in Simcoe and in Toronto. We have 14 designers that lay out and design the magazines. When I started in this industry probably 26 years ago, everything was hand done. Now everything's so automated, done on the computers, and that's probably been the biggest change for me.
My name's Phil Wiersma and I work for Rasson Services. We're an industrial contracting company, so we do some custom fabrication and mechanical and electrical installations and repairs. We've built large pump skids for the oil sands out west. We've done some major factory overhauls and expansions. We do some fairly large jobs for a fairly small company. I've always liked to take things apart and put them back together, and so this is just another stepping stone.
My name is John Brock Picard. I'm 20 years old and I work at Ramblin' Road Brewery Farm. Here we make 8 different kinds of Picard's Extreme kettle chips. It's all on one line. The potatoes come in from the farm and we put them in through the hopper. They get cleaned and they go through a grading table where I inspect them and cut off all the rotten spots, pick out the bad ones. And then they go through up to the cutter. They're cut into kettle chip size and they're fried and salted. I guess the best part about my job would be the sampling. When the fresh potato chips come off the line, nothing beats them.
I think young people should be strongly considering a career in manufacturing. Skilled trades, there's always going to be a large demand for that, and they're high-paying jobs. The actual job is getting better as the new technologies come into play.
The skills you need to do my job would be definitely graphic design, computer skill. If you have any kind of video or inclination to do video or any of that kind of stuff, or web design, that's also a huge asset for what we do.
I would say if you like to take things apart and put things back together, or build things from scratch, or if you have even a creative mind, manufacturing is a good way to go.
Welcome to Passionate Folks, a vlog and video series about the people of Norfolk. People that are involved in our community, people that bring a lot of energy. So this is about a conversation, this is about their story. So welcome to episode 3. Welcome to Passionate Folks. I'm Emily. I love to dig in people's lives, ask questions, and learn about people's passion. Today I'm here with Adam. Hi, Adam.
Hi, how are you doing, Emily?
Great. I'm happy that you're here taking the time to sit down with me today. So I've known you for a little bit, small community, but people that don't know you. Tell me a little bit more about yourself.
So my name's Adam Van Passen. I grew up here in Norfolk County. I was born onto a farm and I got to work on that farm growing up, which was a great learning experience. From a young age, I got to understand what hard work was and what it was to be close to nature. So that was very cool for me. Growing up like that, my dad also was a counselor for Haldeman, Norfolk, and he had a big part in shaping what is today Norfolk County. So I got to see that, and watching him and experiencing him work through that really sparked an interest in me for the county and what it could become.
Great. So not like the typical kids. We hear most high schoolers like just ready to get out of their hometowns and go explore the city and something else, and it doesn't sound like that's your story.
Not at all. I heard a lot of kids saying that they wanted to move on to bigger, better things, and I just really didn't have that feeling. I always thought the biggest, best things were here in Norfolk to start.
So I asked you to pick a location today, and you bring me to a place that I don't know very well in Norfolk. Yeah. So tell me about where we are and why you picked it.
This is a very cool spot. I know a lot of people drive by it, maybe on their way to Long Point or into Port Rowan, but this is Boose Harbor. So I grew up on Boose Harbor. My best friend, his family owned this place. So I grew up here hanging out, relaxing, boating, going out fishing, going out hunting. I worked here for a while. I did some volunteer work for the Shriners Club here, doing some chicken barbecues. So I really got to experience Norfolk and how community comes together. There's a lot of people that take up their summer residence here in trailers, and it's very cool to see all these people that are coming from other places in Ontario to enjoy what Norfolk has to offer. So it's just very cool to see that and experience it. One very cool fact about this place is that Boose Harbor has the largest amount of indoor boat storage on boathouses for all of the world.
The world?
Yes.
Wow, that is crazy. This little place.
Yes, absolutely.
Very cool. Something to be proud of.
I would absolutely say so.
So we've been talking about nature. I know you spend lots of time outside. You bring me to a boating place where you like to fish and spend time. So tell me about your passion. Obviously there's a connection somewhere there.
Yes, absolutely. especially recently with everything that I've been seeing happen in the world. I'm very passionate about the earth. So I want the earth to be a good place. I want Norfolk County to be a good place. Everything that I love about Norfolk has to do with outside, has to do with nature, has to do with clean water, clean air, fresh trees, everything. So I just really think it's important to take care of everything that we have here in Norfolk County, and it's not an easy thing to do. So
No. We all have to start and do our part. That's the thing, right?
Absolutely, and I'm doing my best, but it does get very difficult. It's easy to make the change, it's just hard to start.
So we were talking earlier about, doing things around Norfolk and visiting places. I know you're a busy guy, like you work, you're a volunteer firefighter. So what do you do to de-stress and relax?
I would say my number one most favorite thing to do to de-stress would be to just get out on Lake Erie. Whether that's ice fishing, boating, swimming, relaxing. It's just such an amazing place. As soon as you get out on Lake Erie and you get away from shore a little bit, you just come out to this different zone.
Other than this place, like where else do you like to visit in Norfolk County? Where else? What's one of your other favorite spots?
I would say that my favorite spots in Norfolk County would have to be broken into two categories. One is nature, being Lake Erie, boating, all of that kind of fun outdoor stuff. And I also like Norfolk's bounty. Before, maybe you had to go out to a place far away to enjoy all of this beer, wine, food, amazing service, but now we can just go out the back door, and before I can drive for 10 minutes, I found something that I can go to locally that's amazing.
A couple winery on the way here.
Yeah, it has passionate folks in it doing things. Like, it's just great. All around here, there's so many amazing things you can do, and it's just growing, so I love seeing that.
I thank you so much for your time. I love your connection with nature and what you want to do as far as your passion with the environment. I'm in line. We need to come together for this to happen, so hopefully we can inspire a few people with this little conversation here. So
Absolutely.
Thanks, Adam.
Cool. Thank you very much.
We'll
for
see
your
you
time.
soon.
Yeah.
Welcome to episode 7 of Passionate Folks. This is a blog and video series about the people who live right here in Norfolk. I sit down with them, have a conversation, ask them about their stories, their passions. I'm excited to present the next guest. Welcome to Passionate Folks. I'm Emily. I love to ask questions and get to know people better. Today I'm here with Dan. Hey, Dan.
Hey there, how are you?
Great.
Excellent.
Might be you stop by for coffee?
Yeah, well, nice of you to have me. I'm really delighted.
So we already had a good chat, but for people that don't know you, can you tell us a little bit more about you, where you live, and what you do?
Yeah. My name's Dan Fewings, and I was a Simcoe boy, an SCS grad growing up. From 0 to 18, I lived in Simcoe. And then I think I lived in Brantford for a year, lived in Dover for a bit, and then followed a gal up north to Peterborough, or Lindsay, and I ended up spending 28 years there teaching high school. Loved every minute of it. A bunch of different experiences. And when I retired in 2014, I thought, my ma's not doing so well down there. It's going to need some attention. And also followed a friend here, and bingo. And now I live just outside of Simcoe, in between Simcoe and Victoria on Highway 24.
Great, I'm so glad you took time to have this little chat. I want to go know more about you today, and I'm going to be asking some questions.
Yeah.
But first I ask you to pick a spot that means something to you in Norfolk. So maybe start by telling us where we are and why you picked this place.
Well, I love this place, not only for the food, although in my new machination I'm more careful what I eat, so I only have one crepe a week. But I love this place because Jim and Penny, the owners, are good friends. They've hired me to play here. They give the artists freedom to be a little zany here. They're good to their staff. They run a good ship. And I love the outside in the summer. It's rocking. They do a great job getting lots of music in. I think they have music all July, August, and September, like a whack of things. And I also, a few neat experiences sort of got born out here. I have a character, I do the song chef, and they were like the first ones to say, oh, you've got to come in and do it. So.
I love what you're talking about. Like, you're involved in so many things into your retirement that you seem to really enjoy the art. Is that the main thing you're passionate about, or?
Well, I like joy spreading, and the most rewarding thing I think I do is my gal Rosie and I, after we had a trip to Newfoundland, and after I did a tour of Newfoundland, we picked up on the kitchen party notion, and so we have a little duet called the Kitchen Party Orchestra, and we go to the seniors' homes and the respite center in Hagersville and Simcoe.
I have a mover to motion to reconvene in open session at 12:03. Thank you, Councillor Van Riesche. Seconded, Councillor Van Passen. All in favor? Thank you. That motion is carried. Also, may I have a mover to motion that the closed report, HSS 23067, strengthening public health, be received as information, and that staff have been provided direction to put forth to the Board of Health. A mover, please. Councillor Duthie, seconded by Councillor Metcalf. All in favor, please. Carried. Thank you. May I also have a mover to motion that the closed report HSS 23068 COVID-19 funding update be received as information, and that staff have been provided direction to put forth to the Board of Health. Can I have a mover, please? Councillor Van Riesche, thank you. Seconded. Councillor Van Passen. All in favor? That motion is carried. May I have a mover to receive the verbal update on housing proposal as information? Mover, please. Councillor Metcalf, thank you. Seconded. Councillor Duthie, all in favor? Motion is carried unanimously. Thank you. Our next meeting is Monday, December the 18th. May I have a mover to adjourn at 12:05, please? Councillor Metcalf, seconded by Councillor Duthie. All in favor? Motion is carried. Thank you. Have a great day.